India's largest event for NEET PG aspirants. As promised, we have our veterans. From the young to the experienced, you will witness them all in our second session, the panel discussion. To felicitate our veterans, I'd like to call upon our founder and CEO, Mr. Vikram Kumar, our managing director, Mr. Jignesh Kumar, and our assistant vice president, Mr. Kishan Shah. I'd request all of you to welcome them with a big round of applause, because these are the men. This is the glue that keeps us all together and on our feet at Medical Mentor. Now, to welcome our first veteran, Dr. S. Sachidanand. Dr. S. Sachidanand, if you could please make it to the dais. Dr. S. Sachidanand comes with immense experience in the field of medicine and education, where he has served his purpose as the Dean and Director of Bangalore Medical College, followed by which he has served as the Director of DME in Karnataka, post which Dr. Sachidanand was appointed as the Vice Chancellor of Rajiv Gandhi University of Health Sciences, headlining such an illustrious career. But retirement was not the end for Dr. Sachidanand. He currently is a part of the advisory panel for various top medical colleges across the country, and also is a board of advisor at Medical Mentor. Once again, Doctor, we very warmly welcome you to our panel discussion. Please, Doctor. Next, we have Dr. H.S. Satish. Dr. H.S. Satish, we warmly welcome you onto the dais. A big round of applause for Dr. H.S. Satish, please. Dr. Satish is a renowned ENT surgeon who has immense contribution in the field of medical education, where he has served his purpose as the Dean and Director of BMCRI, as well as the Medical Superintendent of Victoria Hospital in Bengaluru. A big round of applause. Apart from this, when the world was struggling due to the COVID era, he has played an immense role in societal betterment as the advisor to the government of Karnataka for the betterment of all of us and all of us in the society. He is also as the board of advisor at Medical Mentor. So Dr. H.S. Satish, we warmly welcome you to the panel discussion today. Next, we welcome our Samaritan, someone you've been seeing through the day today, Dr. Govind S. Mittal. A big round of applause for Dr. Govind S. Mittal, ladies and gentlemen. Dr. Govind is an alumni of BMCRI, plus a gold medalist, and also a topper and the best outgoing student from BMCRI. He has a long list of accolades to come, all right? Along with that, he was also the highest scorer when it comes to his post-graduation, his MD in DVL from Christian Medical College in Vellore. That's a wonderful college to study, isn't it? All the doctors will definitely know of the same. Followed by his education, he has been a part of multiple fellowship and observership programs for laser treatment, not only in India, but abroad as well. To add to his accolades, he has been honored with multiple scholarships, such as the ARTE scholarship from ODAC in Orlando, IADVL scholarship in San Francisco in the United States of America. Currently, Dr. Govind is the Director and Consultant Dermatologist in Therapy Skin, Hair and ENT Center. And to add to his tally, he is awarded with the WCD Scholarship and Travel Grant for the World Congress of Dermatology scheduled in the month of July 2023. And not to forget, Dr. Govind is also the board of advisor at Medical Mentor, who has guided us to put this event through together. We warmly welcome you, Dr. Govind Mittal. Having all these panelists here, the heat is also increasing, so it's lovely to have all you panelists here on board. All right, following our Samaritan, we extend our warmest of welcome to Dr. Kishore Kumar. A big round of applause for Dr. Kishore Kumar, ladies and gentlemen. Dr. Kishore graduated from B.R. Ambedkar Medical College in Bengaluru. Further, he went on to pursue his MD in anesthesiology from the Maulana Azad Medical College under Delhi University. While Dr. Kishore decided not to put the brakes just as yet, he went on to pursue his DNB from yet another renowned college, the Institute of Medical Sciences under Banaras Hindu University in Uttar Pradesh. As of today, Dr. Kishore is the director at Brindavan Area Hospital and Natives Women and Children Hospital in Bengaluru. We are pleased to have you on board with us today, Dr. Kishore. Thank you so much for being here. Now we extend our hearty welcome to the father of modern and super modern diabetic foot surgery, Dr. Amit Jain. A big round of applause for Dr. Amit Jain. Dr. Amit Jain was a professor of surgery in Bengaluru and is a renowned professional around the medical fraternity. Dr. Amit is a visionary who revolutionized medical care, as he was one of the very first going around who laid the founding principle and practice of diabetic foot surgery in India. He also has 6 world records for his work, and his works will also be taught in the books for the clinical years, in the books of surgery, and all the 3rd and 4th year students, that is the clinical years of MBBS, will be able to study Dr. Amit's work. So we are pleased to have you here, Dr. Amit, and I'm pretty sure all of them will also want to learn from you from there. Followed by Dr. Amit is our next panelist, Dr. Deepak YS. A big round of applause for Dr. Deepak YS, ladies and gentlemen. Dr. Deepak YS is a graduate from Dr. B.R. Ambedkar Medical College in Bengaluru, who further went on to pursue his diploma in radiodiagnosis from Sri Devraj Aras Medical College in Kola. Followed by his DMRD, Dr. Deepak completed his DNB in radiology from Raghav Diagnostics and Research Center in Bengaluru. Dr. Deepak is currently practicing medicine as a chief radiologist in Trinity Diagnostics and Imaging Research Center in Bengaluru, and is also a visiting consultant at the various hospitals in Bengaluru. We warmly welcome you, Dr. Deepak, and I'm confident that a lot of aspirants will be seeking your consultation for the day for some clarity. All right, a big round of applause to Dr. Deepak, ladies and gentlemen. Next, we warmly welcome Dr. Pratima Kincha. A big round of applause for our first lady panelist tonight. Dr. Pratima is an alumnus of BMCRI, not only for her graduation but also her post-graduation in MS Orthopedics. Following her education in BMCRI, she traveled across the seas to pursue her MCEH from Rithington Hospital in United Kingdom. Dr. Pratima has also completed a fellowship of the Royal College of Surgeons in 2019 in Edinburgh in the United Kingdom. To add to that, she has been granted the fellowships in arthroscopic surgery and sports medicine in the United Kingdom, the Psychot Fellowship at Prague, and a fellowship in shoulder arthroscopy at Pune. We are delighted to have you on board as a panelist, Dr. Pratima. And you can see that I'm already sweating talking about so much of your fellowship and all your accolades. All right, next we heartily welcome Dr. Sandeep Reddy. A big round of applause for Dr. Sandeep Reddy, ladies and gentlemen. Dr. Sandeep Reddy is a graduate from Sri Devraj Aras Medical College in Polar, post which he had his name etched in the walls of BMCRI as he completed his MD in internal medicine. While Dr. Sandeep specializes in internal medicine, he has also pursued his diploma in tropical medicine health from London School of Hygiene and Tropical Medicine from the UK. Currently, he is the assistant professor in MS Ramaya Medical College, and we extend our warmest of welcomes to Dr. Sandeep Reddy. And I'm pretty sure a lot of their first questions will be, how do I get into MS Ramaya Medical College with my marks? Followed by which our next panelist, Dr. Nitin Yashas. A big round of applause for Dr. Nitin Yashas, ladies and gentlemen. Dr. Nitin Yashas is a graduate from the St. John's Medical College in Bengaluru. He also went on to pursue his MD in internal medicine from the esteemed institute, that is the St. John's Medical College, where he has also served as a senior resident, actively involving and mentoring, training hundreds of mentors, interns, and doctors in the process as well. Also, another such notable achievement of Dr. Nitin is that he was one of the top 5 rankers in the final exam conducted by the RGOHS. How many of us want to do that? Definitely. So that is a commendable achievement, Dr. Nitin. Following his achievements, he went on to complete his DRNB in oncology from Manipal Hospitals in Bengaluru and is also a certified ESMO oncologist. We welcome you to the panel discussion of this mega event. We're very glad to have you, Dr. Nitin Yashas. Welcome. Finally, last but not the least, we have Dr. Pratima A. A big round of applause for Dr. Pratima A, ladies and gentlemen. Dr. Pratima A completed her graduation from Sri Devraj Aras Medical College in Kolar and is an alumnus yet again of BMCRI, where she has completed her MS in OBG. Followed by which she pursued her MCH in urogynecology from Edge Hill University in the United Kingdom. It doesn't stop here, ladies and gentlemen. Dr. Pratima was a specialty trainee in WWL NHS Teaching Hospital in the UK and was also a speaker in the Royal College of OBG in 2022. Currently, Dr. Pratima is a practicing gynecologist in Brindavan Area Hospital in Bengaluru. We warmly welcome you, Doctor. It is a pleasure having you here for the panel discussion today. All right, things are starting to get heated up. I request Mr. Vikram, Mr. Jignesh and Mr. Kishan to kindly remain on the dais as we approach to one of my favorite parts of today, a tangible visual of the hard work and research of Medical Mentor. We are very proud to present our 2023 edition of our book. I now request Dr. S. Sachidanand and Dr. H.S. Satish to join Mr. Vikram, Mr. Jignesh and Mr. Kishan for revealing and launching our very own Medical Mentors PG Medical Guide 2023. This is our effort. We request all of you to clap along and cheer along for this effort, please. The Medical Mentors PG Guide 2023 is the latest edition of our guidebook series, which is a cumulative of all the information with regards to the counseling process, medical colleges across the country, seat matrix, fee structures, bond and stipend details, career and study prospects after NEET PG, such as MCH, Doctorate of Medicine, and even PhD. Apart from such extensive contents, the branch details and the closing cutoff for the branches across the medical colleges in India is definitely a standout feature in the medical guide. And I'm pretty sure, I believe all you medical aspirants, all you doctors will want to get your hands on the PG Medical Guide 2023 to pave the path for you. The PG Medical Guide is what I believe, along with our mentors, will also serve as a guiding light for landing you into your dream branch. I thank the esteemed panelists for being a part of the launch as we set foot into another milestone this year. Now, for the moment you've all been waiting for, it's time for us to begin with the panel discussion with the lovely veterans raring to go. I call upon the moderator for the panel discussion, our Samaritan, Dr. Govind S. Mittal, to take over the floor. Welcome him with a big round of applause, ladies and gentlemen.
Thank you, Niranjan. You've been doing a wonderful job with the mic and the stage. Okay, so without much ado, let's go ahead. Can we have the presentation, please? Medical Mentor, a perfect prescription for your success. So finally, I repeat, 5th March is over and all of you are feeling a great sigh of relief, and quite understandable. This was the day in your lives where you appeared for the NEET PG exam, and it's now time to see what you've done with the results and with the ranking. Now comes the more deciding aspect of your whole NEET PG attempt, that is deciding the branch, deciding the college, and finally claiming it through your rank. So first and foremost, congratulations that you made it till here, but believe me, this is not the end, but rather just the start. So life is a matter of choices, and every choice you make makes you. And the choices that you have are immense. You have n number of branches, you have clinical branches, you have non-clinical branches, and it's definitely not easy to make a choice. This seminar is about helping you to make that choice. Before I begin, a strong disclaimer that I wish to give is that this seminar is to provide some clarity about various branches in the field of medicine and other specialties. There is no right or wrong answer here. The views presented are those of the speaker or the moderator, me, the moderator, and the panelists based on their experiences and understanding. By any means, we do not wish to say that any specialty or choice is superior to the other. We do not wish to ridicule any specialty, and if any such inference felt is not the intention of this seminar. We encourage students to take their own decisions in light of the viewpoints expressed in this discussion as suited to one's needs and interests. With this, let's begin. So what after NEET? So as soon as you must have written your NEET exam, this would have been the scenario. You know, you have probably some idea, something in your mind, ki I want to take up medicine, I want to take up dermatology, if I get this rank, I want to take up. But after 5th March came a very important date. What was the date? 14th March. After which, this is what happened. The ranking came and a lot of truth was unfolded. But yes, one thing was certain, you were given a rank. Now, it's up to you how to deal with it. I know there are a lot of challenges, but now is the time to convert that challenge into a chance to make a beginning of your career. So let's get help in making an informed choice about what kind of doctor you'd like to be. Which branch is suited for me is what you need to answer today. To eliminate the thoughts of doubt and fantasy and to come in touch with reality, facts, and truths about specialization, let's help you take that decision from the experiences of those who have been there and done that. Let's connect with the panelists and listen to their journey. Starting from Sachi sir, I would request each panelist to speak for about 1 to 2 minutes briefly about their journey in choosing their branch and specialty. Please, sir.
Good afternoon, one and all. It's nice to see so many students here and parents. Most of them are happy with their NEET ranks. Some of them are anxious. More so the parents. Now, as Govind has already told you, already gone through the journey. They have cleared their MBBS and now they come to a stage where they have to choose their career in future, what they're going to be, right? If you ask me at this point of time during my life, say 40 years ago, what did I do? When I passed my MBBS, of course, there was no NEET at that point of time. It was all depending on the marks that you have got in your MBBS. That too, in the final MBBS, your future course was decided. Those days, we had a very less number of doctors in our families. Maybe many of us were the first doctors in our families. So we had no guidance from our seniors, from our relatives. We had to choose our own. And of course, at that point of time, medicine was also not that developed as it is today. You have so many other new branches which has come up. So we had to choose between very less branches. And I wanted to tread in a different path. Those days also, medicine, surgery, OBG, pediatrics, orthopedics were the branches which everybody would prefer. Dermatology, nobody. In fact, when I chose dermatology, I had very good marks in my college. I was one of the first in the toppers, but still I could have got any field I wanted. But I chose dermatology because I thought I should be something different. I wanted to get into a branch which was not that popular and make it popular and become popular through that. So that was a challenge I took up, and that's the reason I took up dermatology as such. But today, I'm very proud and happy to say that as it stands today, dermatology is one of the most sought after subject, for whatever reasons. And I am also a part of that growth. I have grown through dermatology's growth. I have contributed to the growth of dermatology, plus dermatology also has given a lot to me. So that way, whatever branch you choose, it is up to you to grow along with the subject, because it is you who are going to modify it or better it or even learn a lot from it. So that's up to you. Having said this, I leave it to other panelists too.
Thank you, sir. I can't agree more. I was a student under Sachidanand sir. I still remember my third year MBBS postings. He was the head of the department. I was a dermatology student under her. So lovely listening to him and his journey. Over to Satish, sir. Your journey in a few words, sir.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. I think Dr. Sachidanand and myself, we were in the same boat, in fact. Only difference was, I never wanted to be a surgeon. But unfortunately or fortunately, I had to choose ENT. But I have no regrets. As Dr. Sachidanand said, we have grown with this specialty. And we have contributed enough to this specialty also. And it has grown very immensely. See, previously, ENT was only about tonsillectomies and nasal surgery, that too, deviated nasal septum. We used to do septoplasty or SMR operations. But now it has grown so much. You go to the skull base. You operate in and around the eye. You do a lot of things now. So, as Dr. Sachidanand stressed, I am also going to stress, see, whatever the specialty, even non-clinical, you have to top it. There is no other way. For example, if you look back, see, Gray did his anatomy, and his books are so famous. In our times, we never had guides. We used to read from Gray. So my advice for you all is, see, I agree, sometimes you don't want to become a surgeon, good. You get into a medical specialty, very good. You thrive on that. You have to develop your own methods. You have to be the best amongst one of those things, one of your specialties. So with this, after congratulating you for clearing MBBS, I wish you all the best. And I think you can hear the other panelists who are quite young. Let us see their views.
Yes. Kishore sir next. Kishore sir, your views please.
Good afternoon, everybody. So as our both stalwarts in their respective field of medicine just told, I would just speak about the same words. It doesn't matter which field we all opt for. Like, I wouldn't say that everybody are born and they have decided that, okay, I'm going to become a doctor and I'm going to become the best cardiologist or a cardiothoracic surgeon or whatever, or dermatologist or anything. Whichever field you opt for, if you excel in that field, that would take you leaps and bounds. So about my journey, I would say post-MBBS, so when we wrote our entrance examinations, we all get ranks and we are anxious, our parents are anxious, our family are more anxious than all of us. Okay, somebody, your aunt comes and says, okay, you have to become Devi Shetty. I mean, they don't even know what others do, but they want to emulate people who are the best in the field, in your city, in your vicinity, in your minds, in your heart. But then, yes, it's a difficult journey. Everybody can achieve to enormous levels with just a little bit of hard work and sincerity. So yes, going forward, we'll have discussions about our respective field, and we will try and guide you what we have experienced as particular doctors in our specialty. And then it's choice that all of them will make one day, and I'm sure all of you will be successful and make proud of yourself and our nation. Thank you.
Thank you, sir. So I still remember the day when I walked up to Kishore sir for an interview seeking a job in the hospital he owns. So he's been an entrepreneurial guide to me. Thank you, sir. And let's invite Amit sir, your journey in brief, sir.
Hello, everybody. I just followed the trend. Okay, the 20 years back, the trend was the top 3 subjects that were running. That was either clinical medicine.
20 years back, sir?
20 years back. I had taken a call.
I'm sorry.
So we followed the trend. Okay, and over the years we have learned the trend changes. So that time the trend was medicine, surgery, and obstetrics versus pediatrics. The super specialties just started booming. So people didn't think beyond. As you see now, those time, sir is right. Though we had dermatology, we were not very sure whether dermatology, radiology, and anesthesiology should be opted or not, because the trend was whatever your seniors do, whatever your guides do, you try to follow that. But we learned one plus point. Never have a total care, I want only that. That is something which our seniors guided. Don't fix your I want only that, because this is an unfortunate thing in the medicine that if you decide I want to become only that, and if you do not become, you'll have a tough time later. So your seniors guided, so we kept 3-4 options ready, and we were very open to take it. We didn't have a lot of options, but you see the trend, exactly opposite. So what we chose 20 years back is not the choice what is there today. So what 20 years back we were in a dilemma, as sir said, they all have become the top 3 subjects which people were not looking at. So what I would suggest is follow the trend. Technologies changes, new specialities, new branches have come into the picture. Do the survey and choose it. That time, what we did, we felt that was the best. But now, with more variety and options coming, I think you all are lucky because so many subjects which were not heard 20 years back has an evolution now. So I feel that you have much more better options coming up, so you do have to feel more happier that so many options are available today.
Good afternoon. Thank you, sir. That was really nice. So I think taking on from that talk, we were lucky to have all the branches exposed to us at our time when we had to choose PG. So I totally agree with the fact that don't stick with only one choice in your mind. Have a plan A, plan B, plan C, which is sensible. But if you are getting the field that you want, definitely go for it. So for me, orthopedics was my love. So in the counseling process, I did not get an MS orthopedic seat as per the general merit quota. But I did have an MS in ENT and general surgery. I had all, MS and MD degrees still available to me in Bangalore. And, I did surprise all the members ahead and, behind me when I chose diploma in orthopedics. And they all looked at me and saying, are you sure orthopedics, not ophthalmology? Are you making a mistake in the form? So, what I want to take, what I want you to take home from this is you will face that choice now, whether you do a diploma, whether you take up an MS or an MD, or whether you take a clinical or a non-clinical branch. But if you love what you're doing, you will definitely go on to excel in it. So all the best to all of you.
Thank you, Dr. Pratima. I don't know about joining bones, but she can break your bones. She's my BMC batchmate, so I know a lot about her. So from one Pratima to the other, Dr. Pratima Anugondanahalli about her journey with OBG.
Right. So from the day I started my MBBS and the first cadaver in front of me and doing the anatomy dissections, I decided I'm going to be a neurosurgeon for some reason. Yeah. And then I got gold medal in surgery for my batch, and I was very, very happy. And then internship came along, and then I fell head over heels with pediatrics. I was like, oh, that was so amazing. And I got distinction in pediatrics as well. So I was wondering, pediatrics, surgery, what do I do? And being a third generation doctor from my family, my mother being a very well-known obstetrician, I really, really did not want to do obstetrics. So then came entrances, and we didn't have NEET yet that time. And we wrote about 20, 30 entrance exams, I think, for so many various colleges and institutes. And then I got really good marks in most of it, but then I was so blindly in love with pediatrics. I could have got OBG in BMC aram se, but I said, no, I want pediatrics, which was a little difficult to get in the places which I wanted to get. So I chose MD Pediatrics in a very distant place. It was very nice initially, 6 months of it. Went into severe depression. I couldn't continue there any longer. And then my father brought me back home. So then, for the next 2 years, I've given every entrance there is possible in India. And then it was a very, 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 very difficult time for me. I used to get a rank, but not enough to get the subject which I wanted. But I had a really, really great support system from my family, my friends, and everybody was like, just keep on giving and let's see when you get. And then finally, I got a really good rank in the NEET, and then everybody said, okay, your second option is OBG, right? Why don't you just try it? And then I took OBG in Vani Vilas, very, very, very busy hospital, and I just fell in love with it. And how can you not fall in love when you're seeing chubby, cuddly babies come out and just giggle and laugh at you? So it's been an amazing experience afterwards. So that's the one thing I have learned. Whatever branch you get, you have to fall in love with it. So first it was a love marriage, which kind of didn't work out. Then, yeah, I sort of went for an arranged marriage and just fell in love with it. So that's been my journey.
That was indeed beautiful. So the point I want to bring out here is everything is not rosy out there. There will be ups and downs like the waves on an ECG. It's about going on and going ahead and enjoying finally falling in love, whether with the arranged spouse or with your original spouse or whatever. So thank you so much for those experiences. Dr. Deepak YS, I've known him since my school days. So Dr. Deepak, your tryst with radiology.
Just like Dr. Pratima, even I've been a third generation doctor, so I was like very lucky to have guidance from my father's friends and everything, being big stalwarts in their own fields. So they actually helped me a lot in deciding what subject to take, and they actually kind of decided radiology is a good thing. It was an upcoming thing 15 years back. And since I was also in love with technology and observatory skills and everything, I actually looked upon, I liked radiology and took it up actually. But all said, like the others have already told, it's the passion which is the most important. Any subject you take, it's the passion. So unless you don't have the passion for that subject, you can't excel in it. So develop that passion towards your subject, everything else will just follow through. That's all. Thank you.
Yes, Dr. Nitin.
It's very interesting. I don't think Vikram and Govind will remember that even last year Dr. Amit Jain was talking about love marriage and arranged marriage whenever we talk about PG. So that I think is always a recurring theme as such. So I was very, very confused after my MBBS, because sometimes when you get exposure to a lot of subjects, you develop a lot of interest and you really don't know what to do as such. So I liked medicine all along my MBBS. There was this TV serial called House which was coming, and I assumed myself to be the next House. The way I walk was not real. I don't have the most perfect gait like a fashion model, so I used to imagine I was House making diagnostics. But then I realized that medicine would be very difficult, very strenuous. I was into a lot of co-curricular activities, theater, debates, quiz and all, and I thought I had to give up all that. So what did I do? I actually had a passion towards anesthesia, because when I was doing my internship in anesthesia, the final year PGs were off for exams and the first year PGs had still not joined. So as an intern, I was doing anesthesia as a first year, and I really liked it, a lot of physiology, pharmacology as such. And in the meantime, I read this book called The Emperor of All Maladies, which was about cancer, and I thought, let me try to do MD radiation onco. So actually, I went to CMC for an interview for MD radiation onco. That's when I stayed with Govind, who was pursuing his dermatology there. But one thing I realized the moment I went there, I will not be able to tolerate the heat of Vellore. Even if I get the seat, I'm not. And trust me, these are some important factors which go into making a decision, because when you're doing a PG, it's not just about the subject. It's a lot of other factors which you have to take into account, including the food, the working conditions and all that. So I then said, okay, I'm not going to CMC for radiation oncology. I took up MD anesthesia in St. John's as such. And then after 1 week, I realized I'm a guy who likes to speak, and I'm just not able to speak to patients because they're all knocked out and unconscious as such. And I couldn't imagine, Govind knows that there are many people who will ask me to shut up because I keep going all. Yesterday, Govind told me only one thing, it's 120 seconds. Nitin, finish it in 120 seconds. That's the instruction he gave me. So I realized, oh my gosh, what am I going to do? Then I thought, okay, fine, I'll finish anesthesia and then move into critical care, ICU and all. But luckily that year, many people moved from MD medicine to radiology and pediatrics, and MD medicine opened up. But I still was very hesitant to join, thinking I have to give up my passion and all that. And that's when one of my professors, Dr. Kurpad and Dr. Anil Abraham, told me, always look at what your long-term goal is. Where do you see yourself 5 to 7 years down the line? And if this is the route you have to take to that place, do not worry about the short-term outcomes. And that's why I chose MD medicine. And by the time I choose oncology, I use the same principles. And you see, life is funny. I always believe, don't worry about the decision you make. Ultimately, wherever you are supposed to end up, you will end up and you will do well. Because like I said, I went through radiation oncology, anesthesia, did medicine, and I'm now back to medical oncology as such. life is funny, but if you believe in a higher power or destiny or whatever, you will end up doing what you're destined to do as long as you want to serve people the right way and give your best. That's all.
Thank you, Dr. Nitin. I guess he was just emphasizing that there was no air conditioner in my room in Vellore.
And here also right now.
Thank you. Thank you, Dr. Nitin. But yes, Dr. Sandeep, please let us.
Through my school and college days, I've been a sports person. And once you're in a very high impact sports, injuries do happen. Had a ligament tear. At those days was the hot wax therapy. So all my heart goes out to all the girls. So broke my best friend's collarbone. Studied all about it as feeling guilty. So was very much interested in orthopedics as every bone got fractured, every ligament was torn, tendons. So end of final year, I was wanted to become an orthopedician. So internship starts. Luckily, my first few internship time was with the short subject, so orthopedics. No offense to the orthopedician, but then I felt it's all about nuts and bolts and pull and push. So I was like, this is not where it goes. I still convinced myself that I'm going to be a sports orthopedician. So it's not all going to be nuts and bolts, some arthroscopic procedures. I'm going to be the sports orthopedician for the Indian cricket team. Guidance from her father. So, but then somehow convinced myself through the 1 month of orthopedics. Then when medicine hit, when you have such a good mentors in the form of HOD and the unit chief, and then the postgraduates. I strongly believe it's the postgraduates who do the last sculpture on your life. So I had the most laziest postgraduates in my unit, and I thank them for being what they are, because I was given the in charge to take care of the intensive care and the acute medical ward, because the senior was the third year senior and he wanted to study for the exam. So I did everything for him. Through that journey, I fell in love with medicine. Though my girl was interested in surgery, I wanted to impress her. So during my internship in critical care, the emergency medicine, I used to impress her by suturing the wounds before her team used to come. And there was an incident where her team came and the consultant shouted at the intern who was her and said, "Who did such a bad work of surgical suturing?" So I said, okay, surgery is not for me. So just stick to medicine. So medicine was the first love. I had plan A and plan B. Internship finished, exams was given, counseling, ranks, not up to the mark. I remember walking into AFMC counseling, was getting anesthesia. So I could have impressed my father-in-law. He's an anesthesiologist, like, I'm taking your subject, but still medicine was still there. Walked out of the AFMC. My marriage date was fixed. I still didn't have a degree, while my girl took up a degree for her course. So there was a lot of tensions in the family. My parents was quite tensed. The girl has got a degree. You're still MBBS. What are your in-laws going to introduce to their relatives? So I was just 2 weeks before my marriage date, I was supposed to go to Delhi for my DNB counseling. I still echo, the echo of my mother's words are still there in my mind saying, take up anything, even anatomy, get a seat and come. I want your in-laws to tell something that my son-in-law has got a degree in anatomy, just take, you can leave it later. I walked in the DNB counseling, I'm sitting there, okay, anatomy, physiology, whatever is there. I think the fortune strikes when I got a message that I got the All India rank, and then I walked out saying, thank you, goodbye, I'm going to get a medicine seat. So I was fortunate enough to get a medicine seat at Bangalore Medical College. The place where my in-laws also studied, so yeah. So I stood there 1 week later on my marriage dais saying, I'm doing medicine at my in-laws' college. So it was a pride moment. So one thing from here is just, I know, keep your plans A and B and C, but stick to it. because as everyone's been mentioning, I want to, end of the day, the only thing matters is when you go to your bed, do you have a sound sleep or not? You might be the richest consultant in whichever field you are for the money, but you'll be spending most of it with the psychiatrist and psychologist rather than spending on yours. It's the good night's sleep so that you can face the next day with all the energy you've got. So that is very important. Do not pursue, there are a lot of factors, we'll all talk about it, but it's the love for it, stick to it, hold on to that dream, one day it'll come true. So, enough of me. Let's hear from Dr. Govind, the golden boy of the hour. See how is life spread out.
Okay, so in interest of time, which is running out, I'll just keep it very, very short. My first love was surgery. Okay, so all throughout MBBS, I thought being a surgeon was being very glamorous, to cut and to paste and to make a real change that you can see. So I always wanted to take up surgery, but slowly as I did my internship and stuff like that, I realized that I'm not a person who can work under a boss for too long. And as a surgeon, so that's an individual trait. So to continuously take orders and to work under someone. And I realized if you want to make a career in surgery, you may have, and coming from a totally non-medical background, I have no doctors in my family for several generations. So I was like, okay, maybe settling down in the center of a city, being a surgeon is going to be tough. Of course, my second love, as I started going to my third year and my final year, studied under Sachi sir as he talks about the growth of dermatology, saw dermatology as a growing branch, and that's when I was like, okay, being a dermatologist really seems to be good, a branch that I could take up. Also, I was like, in case I don't get dermatology, I want to pursue internal medicine followed by endocrinology. That was something I really liked, but I got dermatology in CMC Bellore, and I can't be more thankful about it. So that's how my journey unfolded. We will see more, we will answer more questions, we will see more. And this is a wonderful slide which Sandeep sir has contributed. So rather than me talking about it, I'd want Sandeep sir to talk about the slide.
Yeah, I'm going to use the help of the other panelists also in decoding these questions that I've come up with as I used to mentor back in the UK. These are the main questions that you need to ask yourself before selecting. It'll help you before selecting your specialty. The first question, the most important question is the diagnostics or therapeutics or both. Now, if you're a person like Dr. Nitin, who is more of a patient interaction, who wants to keep talking, then diagnostics is not for you guys. You can't speak to the slides and the microscopes and the x-rays. It just does, people will think there's something wrong with you. So you've got to think whether this is your, it all comes down to your personality. Second, the predictability or the unpredictability. If you're a person who's with a personality of where you want certain things to be at a certain place, don't like your pen to be on the other side, don't want your books to be laid down somewhere, so emergency medicine is not for you. So things have to be very clear with how your life is all been and how your life would want to go. I still remember when during my post-graduation, we used to have postings to dermatology, radiology, and other postings. So I was sitting along with the dermatologist. He was just having a word with his patients, and at the end of the session, he turned to me and said, "Sir, your life must be very much adventurous." I was like, "How come?" So you'll be looking at graphs, you'll be giving injections, you're doing CPRs, you're doing life-saving measures, while I sit here and give lotions and creams and tablets to my patients. Then why have you selected the degree? It's just that I was sitting on the counseling room and the ranks just came up and the slots opened up. I thought it's going to be a nice, rich life I had, and I went in, and this is not what I want to do. I wanted to be more on the intervention side. I want to be more on the surgical side, but this is nowhere going. So he's repenting after the 3 years of his post-graduation. So very bad mistake. The third point about certain kinds or ages of people, Here, one thing I would want you to completely specify is just because you like kids doesn't mean pediatrics is the thing for you. Nope. I love kids. I love my 3-year-old daughter, so it doesn't mean I love pediatrics. Pediatrics is completely far. Because for me, pediatrics is, during my internship, pediatrics was such a delicate moment. With adults, I can start on a treatment, go away, go have a call, come back 6 hours. I have got about 6 hours of time to see how my patient responds. But with pediatrics, they're so delicate. Even as 1 hour, you're there, it's all good, on the vitals are looking good. You're just going for a coffee break, you get a call from your nursing staff saying the baby crashed. This is so delicate, not for me. The doses have to be apt, completely. It can't be underdosed, overdosed. It has to be spot on. Not for me. My memory is not very bad. Can't remember my wife's birthday. So forget the doses. So it becomes very important that just because I have, there are a lot of issues, there are a lot of thoughts that I love kids, so pediatrics, nope. No. So it doesn't go that way. Just because you like old people, geriatrics is not for you. It's a very complex procedure.
I like girls, but I'm not Tego.
Again, can you work
Some
in
confession from Amit sir. He said he likes girls, but OBG is not for him.
OBG.
So, work in a team environment, are you a team person or you're an individual go? Right now, medicine is a team. You've got to have the methodology and the cleverness to convince your surgeons to put the antibiotic of your choice or to go the way you would like to go. So you got to be there. Pathologists, your paraclinicals don't have to do that. They just have to give you a report. They don't care who else wants you to do. So that becomes very important. Verbal communications, as Dr. Nitin mentioned. And the last one, career goal, always long terms. Do not look at the short term. Long term, 10 years, where do you want to see yourself? That becomes important. Do not look at the short term goals. And the last one, as again Dr. Nitin mentioned about the welder, or on a simple reason, I walk into every time the labor room, I completely understand why I didn't take OBG. So it becomes important of where you want to work, not just the specialty. Do you want to work in an environment where you're suited for? That becomes important. The recent movie, the Dr. G, exactly, wanted to take orthopedics but went into a different environment. But finally, he started to learn how to go about it. In the end, he started to mastering the skills that's required for that environment. So it just becomes important to look into all those aspects. These slides will be presented to you. So please ask yourself all these questions and it'll help you, I'm sure it'll help you where you fit your specialty as you go forward.
Thank you, Dr. Sandeep. Dr. Nitin wants to make a point.
Yes, so sometimes this is so comprehensive and so brilliantly done, but there's one small thing, is that as MBBS students to certain subjects like anesthesia, psychiatry, dermat, or even, for example, nuclear medicine or fancy things like geriatrics, we don't have much exposure. It's hardly 1 week, 2 weeks, and there you're all going as students because you want that attendance, and now you have biometrics. So 90% attendance, 75% attendance goes to RGHS, you have to attend, you go there or you keep doing your record work. Instead of hashtag postpone NEET PG or all the other Twitter storms that's happening as such, the one good way to make use of this time is shadow. You like a department which you have not had much exposure to, go and be in the department with the mindset of a PG during this time till counseling happens. And when you're there without the sort of, I was lucky because, because at that time NEET was not there, it was multiple exams, so you had that opportunity where I could leave and shift and all. Nowadays it's very strict. You have round 1, round 2, state round 1, round 2. You can't leave without a huge penalty. So make use of any time till counseling which is there. I would strongly advise to go to any of these niche specialities or even, for example, pathology.
So I get the point. The point Dr. Nitin is trying to make is make use of this time, and I think all the panelists here would be happy to either have any of you shadowing them or connect you to anyone who would be happy to, whom you would want to shadow. So if you want to explore a specialty, do feel free to reach out. make use of this time to understand what life will be for you maybe 5 to 10 years ago, so that you don't live in a fantasy world, but you live in reality. That's the point we are making. Thank you, Dr. Nitin. So how should you approach choosing a branch? This statement has been used n number of times, but it still stands the test of time. Yes, it is the only thing apart from your marriage that stays with you for the rest of your life. Yes, you may have affairs, you may have divorces, but yes, you're choosing a life partner. Okay, so that's very, very important. Are you really interested in the partner that you are going to get married to? So are you really interested in the subject that you're going to take up? Where do you see yourself 10 years down the line? And what can you imagine yourself doing? I can relate with Dr. Pratima. It's such a beautiful feeling. I think one of the best feelings for me in my internship was to deliver a newborn baby. Have that mewling baby in your arms is extremely beautiful. But someone's boon might be someone's bane. Like Dr. Sandeep could just not handle the girls or the women in the labor room, constantly crying and shouting. It's not everyone's cup of tea. So it's very, very important. Do not look at short-term stress or gains. PG life is going to be tough. So whether Vellore air conditioner is there or not, it's a 3-year process. So, I would like to, differ a little bit there. Don't look at very short-term stress or gains while choosing your career.
Right. If you don't mind, Govind, so just going back to that one line, I think we all agree that, do not look at the short-term stress that is there, but there's a difference between the short-term stress versus absolutely not liking a field, okay? So, for example, myself, you have to do 2 months of OBG, otherwise you're not going to get your completion, you're not going to get your degree. So yes, I was in Vani Villas, there are ladies screaming outside, we had to do deliveries, 81 deliveries, and in those 2 months, I lost 5 kgs. I could not eat, I could not sleep, and so these are things that you would pick on in MBBS, as much as picking what specialty you like, you will definitely pick on what specialty you do not like. So even if you have it's one of the best branches, well-paid branches, you know that you're not going to be able to tolerate it, I think that is something that is very, very important for you to take in.
Sure. In fact, we have a slide on how not to choose a branch. So thank you.
Sorry, I skipped it.
No issues. Great. So what are the other factors that you should be looking into apart from one's own interest? PG life. Yes, it is important how the PG life is going to be, but yes, it is still a short-term thing. What is your future life? How you imagine yourself in future life? Are you a family person, or are you a person who's just a workaholic and can compromise on family life, are you looking for a particular social status or prestige associated with a certain branch? Are you a person who cannot do night duties, or are you a person who cannot wake up early in the morning? Now, Kishore sir will agree that if someone cannot wake up in the morning, he'd better not take up anesthesia. Yeah. So that gender bias, there are women on the stage who have broken gender bias. So, but I was scared of taking up OBG because I was scared that how many women would come to a male gynecologist. So there's a lot of gender bias. Early settlement issues, earnings, saturation of metros, expenditure on setup, and medical and non-medical background. So the platform is open for the panelists. I would want the panelists to give their opinions on various other factors that one should be looking into apart from the primary interest. Sachi sir.
How many of you in the crowd are determined to become dermatologists? Just raise your hands.
It is perfectly fine.
Yeah. How many of you in the crowd are okay with dermatology? If you get it, I don't mind doing it. See, this is the trend. This is what's happening. As Amit mentioned earlier, the trend was different 3 decades ago, 2 decades ago, and now it's changing. So I'm sure all of you, more than 80% of you would have already made up your mind. You're all intelligent a lot. You have made up your mind what specialty to choose, right? But it is the question of whether you're going to get it or not, depending on your NEET ranking. That's what you're all anxious about. I hope all of you get what you are desirous of. What I mean to say is follow your passion. If you already decided to select a subject, and if you are having a 90% chance of getting it, please choose it. Because you already made up your mind. There must be reasons for you to have arrived at that particular decision, right? So pursue your passion. If you want to do a subject, do it. Why I'm saying this is, in medicine, if you ask me, all subjects are equal. It is up to you to excel in that particular field. You're talented, you're ambitious, you can reach the top. Whatever subject it may be, whether it's preclinical or paraclinical or clinical, doesn't matter. So that should be your goal, but to pursue a course and to select a career, you have to choose some subject. For that reason, you go, you follow your heart, that will guide you, right? So I wish you all good luck in that.
Thank you.
We'll come to that later on.
Dr. Pratima Kinchak, can you throw some light on gender bias of specialties?
Right. So, like I said, a lot of people kept questioning and re-questioning my choice in orthopedics. And that happened during PG time as well. So, how many of you have pulled out a K-wire or, given traction? I see one hand over there.
A lot of.
Now, all of you have given traction,
wow,
right?
Wow.
Good. So, I think this is what, you have to be really mentally and physically and emotionally strong, no matter what branch you choose. Because I've had my senior PGs, as soon as there's a K-wire that they're not able to remove, they'll be like, haan, ladki ko bulate hain. Chal, now you remove this K-wire and, show me you wanted to take up orthopedics, right? Show me that you want to do it. So, it's not only brute force that is required, it is technique, it is instrumentation. And this is there for all the branches, right? So I think that old age phenomenon of you need to be a male, you need to be, have brute force to do orthopedics, that is all gone out of the window, and I'm sure you've all had the exposure to it. Despite all this, yes, you will always have some amount of silly jokes that are said, but as long as you can laugh it off, because you've chosen what you wanted to do. Okay, all of this is going to happen. It will happen even if you're in a branch where, which is acceptable and doesn't have gender bias. So it really doesn't matter anymore, is what I'm trying to tell you, You're irrespective of being a male or a female, choose orthopedics. Irrespective of being a male or a female, choose OBG. And I'm sure Pratima will agree with me as well on this, that at the end of the day, be mentally strong and you can really get through anything.
Thank you. Kishore sir, thank you Dr. Pratima. Any points on how important it is to have a medical background or a non-medical background?
Oh, fantastic question. So, I have not been as lucky as my other few panelists to have guidance from my father or grandfather or any family, in the medical background. I was the first person to do medicine in my family. Definitely very important to guide you along, because they would have seen the ups and downs and changes, advances, nuances, obsolete things which are going to go and which are going to foresee in the near future. So yes, today, even if somebody here in the crowd are from the first generation doing medicine, so we all are here to help you out in this. My first question would be, how many of you have first choice as anesthesia among this crowd? Nobody?
About
Quite
5 hands.
Okay, can I ask anybody to just tell me why is anesthesia their first choice? Those who raised the hands. No answer. Anyways, just to reiterate, my All India rank was 200. I was the first person who opted for anesthesia in All India rank in my year. So, again, as anybody would say, why would a fool do that? So, as all our panelists have told, you need to have passion and love to the subject what you want to do. It doesn't matter which it is. And when I took anesthesia in Maulana Azad Medical College. And once you decide to pursue a particular branch, stick to it, it's going to be a hard life. When I went there, my first question, my professor would say, oh, Madrasi aa gaya. Then I would like, okay. So 1 month, Madrasi, Madrasi, Madrasi. Then one day I just got up and told, ma'am, I want to talk to you. And she would be like, what? Bolo. Madam, मैं Madrasi नहीं हूँ. Then she would be like, with a stern look. I would say that, madam, आपने कावेरी का नाम सुना है? She was like, ये क्या है? Madam, river Kaveri. She's like, हाँ, so what? Madam, still river Kaveri is going to be there. Madras and Bangalore cannot be one. Then she would be like, what is this? I tried to explain her very slowly. Madam, there is something like this. So, Madras is different, Bangalore is different, something like that. She just quietly looked at me and she told, जाने दे, गाजियाबाद से नीचे जो भी आता है ना वो मेरे लिए सारे मद्रासी है. So you'll face everything, in your postgraduate life, maybe post fellowships, everything. Stick with what you want to do. Take well guidance from your peers, from your colleagues, from your seniors, and who are there in and I'm sure they're going to give a good light on how you want to go about your subject. And yes, it's tough time.
Thank you. So there are more slides about how to select your branch, but I think I will move to the subjects and come back to these slides so that we can make more sense of this, and we will come back to the slides about the selection of your branches. But let's first understand from the specialists about their branches in detail, because they are here and I want you to make most out of them to understand their branch better. So let's go branch by branch. The first branch, surgery. So before I put out the slides, now I actually ran an exercise where I ran a questionnaire amongst 150 batchmates of Bangalore Medical College 10 years after their MBBS, asking them to tell the advantages and disadvantages of the branch or specialty that they were doing. So these slides have been prepared verbatim based on the words, sentences that they have provided. I have no prejudice, no ridicule added to any of these statements that I have made. The people on the dais can very well beg to differ with these statements made and give their own opinions completely. Okay, so yes, Amit sir, so if you want to, you need not refer the slide, you can talk about the advantages and disadvantages of your field, sir.
See, the advantages which was there is something like the thrill you have to operate on somebody and try to cure him of the disease. You feel very pride, oh, I've tried to save the person's life if it's an emergency, or I'm able to suture, or I'm able to reconstruct some organ. So that was the pride, what we thought about it. And as I said, the trend of the time, 20 years back, was a surgical field. I'm just not talking general surgery, overall surgery and medicine. So a lot of people used to think that there was a pride walking as a surgeon, you used to earn more, and you would get a more respectable thing of this. The entire trend has changed. So you need to decide what you want to do it. So what was there earlier is not what it is. Because though a lot of advantages are seen, I would like to focus a little more on disadvantages too also. Why? I said the technology has increased like anything. So what you have learned 5 years back in the surgery, after 5 years, it can become an obsolete, which is not there in many of the fields. So you can see, earlier we were loving to do an open surgeries, and then like laparoscopy came into the picture, and all of us are struggling to learn laparoscopy.
And you have a lot of fellowships in MCH which are almost mandatory. And one of the problems is, what my friend told me is that training in some of the DNB institutes may be suboptimal. So if you're choosing a DNB branch for ophthalmology, please do your research. So coming to something which is just not my cup of tea, because I need a patient to talk to, I cannot look at screens, but Dr. Deepak can do that very well, who's reported my MRIs and my X-rays. Dr. Deepak, over to you.
So I see an equal number of advantages and disadvantages in radiology. But certainly there are a lot of advantages and there are a lot of misperceptions also regarding radiology, that we don't interact with patients and you're not treating them directly. That is something I don't agree with. You actually interact with them, especially while doing an ultrasound. You have to interact with them. whatever it is, you have to be a good clinician. You want to be whatever field you choose, you need to be a good clinician. So only when you interact with your patient, you will get to know actually what their problem is, what the doctor is thinking, so that you know what to scan, what to see specifically for, and what should be your report, which will actually ultimately help them in getting them the right treatment. So you might not be treating them directly, but indirectly in the background, you'll be playing a very big role in the treatment of the patient. So whether telling how big the tumor is, where it is going, how they need to do, what kind of a fracture is it, is there any infection there, what is the kind of thing they have to do next regarding the infection in the kidneys or where. So certainly our inputs play a big role. So we might not get directly acknowledged as a radiologist that you have treated the patient, but indirectly, yes, you've played a very big role, any of the paraclinical, even the pathologist or anyone. So we are the backbone structure of all the departments actually. So you don't have to feel bad, oh, I'm not treating any patient directly. You're actually treating quite a lot of them, getting them the right treatment. So ultimately, as a doctor, I feel you have to get the right treatment to the patient either directly or indirectly. So all said and done, so radiology does have its lot of advantages. One of the major disadvantages of late, I feel, is the capital intensive investments you have to do. So if you want to do it in a small way with just the ultrasound, probably it might not cost you much money. But otherwise, it's a pretty capital intensive subject. So if you want to have your own setup or anything, it is capitally very intensive. So, and one thing is, yeah, you do get a good work-life balance because you go back home without taking any of the headaches. So you have done a surgery, you do your, I mean, you'll be thinking about how this is a post-op going on, or in the ICU or NICU, how the baby is doing anything. One thing for us is you do the job, you give your report, you're confident about your report, you don't have to worry much because everything else goes to the next step. So that way you actually go back home with a clear mind, with a free mind. Then artificial intelligence, yeah, they're telling it's going to take up our job, but I don't see it happening, at least in the near future and at least in India. Because ultimately, medico-legally, it has to be signed by a doctor. So a robot can't sign for us. And already whatever is developing and with the things happening, I mean, there will be a differential diagnosis for everything. So it can't be pinpointed even with artificial intelligence. So ultimately, I don't think so our job will be affected much. It will be probably made easier. That's the thing. So it might, when you're doing a lot of volumes of studies or a lot of cases, it might help you in making it more easier. I have but faced this problem. Some patients won't even know that you're a doctor. Yeah, they think you're a technician or anything. So they think ultimately it's only the treating doctor who is a doctor. But ultimately, as I told you, what is all required is how am I going to help this patient get treated and in the right way. So that's very important. I feel in whatever subject you take, whatever subject you choose, how am I benefiting this patient? Is he getting the right treatment? Is he not going to develop any complications? I think end of the day, we need to be very satisfied with what we're doing and how happy the patient is going to be with our treatment.
Sorry, I just wanted to say, Dr. Deepak, really nice, you know. So, I think all specialties now interact with the radiologist to really say, you know, this is what I'm thinking. Can you look at it? You know, can you suggest what needs to be done? So I think it's really important to understand that no branch stands by itself. You will always be interacting with other branches. So if you were thinking of having, you know, an aram life, I don't have to talk to anybody, I'm just going to sit in an AC cabin. So no, that isn't radiology anymore.
Yeah, like she said, you have to be on the top of your game every time because you're going to interact, in radiology, you're going to interact with your peers. So you're going to interact with someone who is very well read actually. So you need to match with them. So at once you'll be interacting with a gynecologist, so you should be able to tell what about the baby or about the fetus or anything. Next minute you'll be interacting with a neurosurgeon, how bad is the tumor is, so you need to interact with them. So since it's more of a peer-based review kind of a thing in radiology, you always need to be on top of your game, so it's a constant learning curve. And it's not that nowadays with intervention radiology, it's not just diagnostics, we have gone into the therapeutics also. So interventional radiology is a big thing now, a lot of things, lot of therapeutics happening with interventional radiology also.
Just to second what Deepak was telling, that you need to be on the top of the game. If I say that a radiologist should know the entire brachial plexus, do you guys agree who are sitting here? I'm talking about brachial plexus. You'd be like, What, am I mad? Only an orthopedician or a, peripheral nerve surgeon should know about brachial plexus. No, dear, wrong. When they are reporting the nerve injuries, the musculoskeletal disorders, they learn everything because, as Deepak says, they need to interact with a surgeon who's going to call and say, Doc, what do you feel? Which nerve would have been damaged? So where's the compression? Where's the injury? So yes, he needs to be on top of the game. It's no easy, but yes, it's a very good branch. I just love radiology.
So I think a lot what we need to understand, and I'm speaking matter of factly, is sometimes there is this mindset that if you enter radiology, you will be able to make money faster. Was the prevailing sentiment about...
So that was the question I was actually coming up to, just to cut you short. How many of you have got a rank where you can get an All India quota radiology seat? You think you can get an All India quota radiology seat? Anyone? Okay, we have at least 5 to 10 hands up. Okay, great. So the common question is, just because I have got a very good rank, should I take up radiology? And I think that was the lines what Nitin was talking
So what I want to tell is, radiology is so important for me today as an oncologist. My trust in certain radiologists is more than the others. And that's where the radiologist, like he rightly said, has to be at the top of the game. And interventional radiology is changing the field of oncology. Today, if we have a cancer which has spread from the colon to the liver as such, and it's only in 2-3 areas, you know who helps us? The interventional radiologist. Because we are able to inject chemo directly into the liver tumor only because of the interventional radiologist. We don't even refer to our surgeons sometimes. There are a lot of advanced work which interventional radiologists are doing, not only in oncology, vascular surgery, many other things, that the field of radiology is not just limited to diagnostics or doing reports. And like he said, any backbone of oncology or high-end is pathology and radiology. And while the patient may not give recognition, it's very, very important to know that without these two branches, it's impossible for clinicians to treat the patients.
Just to add one example of the word which I said, a classical example of trend. Whenever you do your homework, trend setting is important. 20 years back, cardiothoracic surgery was #1. Don't mind, radiology was somewhere which people would never look. 2023, radiology has come into the most top end, and cardiothoracic surgery is the least seats available, nobody wants to take. Not that the subjects are good, it's called the trend setting and the demand what people are looking into.
I think life is all about demand and supply. But yes, so we move on to the next specialty.
Yeah, I think
Any more
about
comments?
the payment, the earning part, I think.
Please go on, you can talk.
They will love to hear.
I mean, yeah, all other specialties, there's a pretty big ceiling. I mean, you can go earn quite a lot. But kind of radiology, you tend to plateau after a certain time. So only thing is you start to earn as good as the senior guy in a very early stage itself. But you tend to kind of plateau, like how they've put in the slide itself. Though you're senior, you might not get. But only thing is, yeah, as you get senior, you have to do more number of cases, so that's how you actually earn. So it's the physical stress, that's the only thing. But it's not that highly paying like the surgical subjects or anything.
Cool. So earnings with respect to medical specialties is something that I'll be taking up. Every specialty has a ceiling, and after a certain extent, it's only about scaling up in terms of volume or number of centers or branches that will help you scale up in your specialty. Going on to anesthesia. Dr. Kishore sir. So one of my friends rightly put it as backbone of all surgical specialties.
Thank you.
Go on, sir.
Anesthesia. So my peers, my colleagues, if I would ask them why anesthesia they chose before I chose my subject, the first answer would be it's a dead-end specialty. Do you guys agree? Is it? There is no specialty, if you ask me, which is dead-end in the field of medicine. Medicine is a constant subject of learning till you die. So I would rather rephrase the sentence. So there's nothing called as a dead-end specialty. Maybe the line which here meant that once you finish your postgraduate degree, you can immediately start practicing, and yes, you can make your livelihood. That's all it means. But in no way, academically, professionally, or skill-based learning-wise, it is a dead-end specialty. Relatively easy clinical branch to get. Yes, maybe because when I asked if anesthesia is the first choice, there were very few hands which were raised. My dear friends, I can tell you as an anesthesiologist and as also as a director of a hospital, the toughest person whom I have to get are good, skilled, trained anesthesiologists. I don't get them. Ready to pay anything, but we don't get them. So you guys, anybody, if you can finish anesthesiology, you can ring me up. You always have a job.
He's a director of a couple of hospitals in Bangalore. So.
DM and fellowships optional, yes, very well. There are pediatric, neurology, cardiology, anesthesiology, and it has diversified like any field of medicine, like an MD medicine, and you go ahead and do a super specialty in anesthesia as well. Responsibility of the patient is indirect. Little contrary to that. Nowadays, see, in earlier days, the surgeon would post a case for anesthesia. The anesthesiologist would just enter into the OT directly from, behind the door or front door. The patient wouldn't even know who is giving him anesthesia. Half of the time he's in mask, scrub, and they wouldn't even know what is his name. Things have changed. Today there's something called as pre-anesthesia checkup. An anesthesiologist is not called an anesthesiologist anymore. He's called as a pre-operative physician. He needs to know the entire physiology and pharmacology of the entire human body. So he talks to the patient, he introduces to himself, he takes the history, examination or whatever, everything like a pre-operative physician. Then he comforts the patient, takes him to the surgery, to the OT, gives anesthesia. Post-surgery, he visits the patient in the ward, takes care of them till the recovery or the pain management, and then the patient walks home. So this responsibility of patient has kind of become a little direct and more interactive as upon which was on earlier days, which wasn't there. Versatility, that line is the most important of all the options mentioned here on this slide. It's very easy to move into critical care or pain medicine because this is the only field where you will be doing invasive procedures in your postgraduate period of your 2 years and of a diploma or 3 years of masters. So the kind of procedures which is required in intensive care medicines, like putting your central lines, arterials, your ICDs, your intubations, your ventilator management, no subject can have that much exposure as much as anesthesiology in your 3 years postgraduate period. So if anybody are a game to do or to enter into intensive care medicine, I would say this is the subject. Not that if you do an MD medicine, you cannot go into critical care. No. Yes, definitely after your MD medicine, you can still pursue your critical care medicine. But anesthesia will give you an advantage. It will give you an upper edge in terms of skills. Your hands-on skills in your 3-year period would be top-notch. Then if I ask you a question, suppose there will be a doubt, sir, I want a very good life, a family life. I don't want to enter into a critical care medicine. Do you guys think critical care medicine means, is it a 24/7 job? Is it? Is it that are you on call all the time? Yes or no? Critical care medicine. I'm seeing few heads nodding this way and few that way. Critical care medicine, just to allay your doubts, it is not a 24/7 job. Critical care medicine requires a specialist to be on the floor in the ICU in their duty. So if somebody is there at 8 o'clock till 2 o'clock, he is there. Once he finishes and go, it's not that he's going to get a call and he has to run and come and attend an emergency. There has to be another consultant on the floor of the ICU. So just to remove the myth that if you take critical care medicine and then you're stuck, you cannot take 1 day vacation or you cannot go for a movie. No, it's wrong. So critical care medicine just means that you are dealing with critically ill patients. You are in your ICU. You need to have that complete skill sets to take care of such patients. And yes, sometimes your 2 o'clock shift might go to 4 o'clock or 5 o'clock. But it's not that 24/7 you cannot go out of your hospital premises or your surroundings and do other things. So guys, if you're good or interested to critical care, it is the subject to take. And critical care medicine deficiency, yes, I need not tell. Entire country, in our country, the most lacking or most deficient subject is critical care. Everybody opens up ICU, but there are no consultants to take care of ICU because a lot of people are not really interested or keen, or people don't even know what exactly critical care medicine is. So yes, this is up for grab. Disadvantages, Not considered a cool and a fancy branch. Very cool branch.
Sir, lines are not mine, sir. Sorry.
We are always in an air-conditioned environment. Unlike, OPD doctors, sometimes they need to sit with a fan which is not working at times. Relatively less earnings. Again, I wouldn't go with that. Anesthesiologists do earn very well, no doubt about that. Stressful at times, okay. Feels like underpaid. Now, who doesn't feel like underpaid? You ask a CEO of the biggest company, you ask the cardiothoracic surgeon, you ask the surgeons, everybody feels they are underpaid for what job they do. Do you agree with me or not for that? So but that shouldn't discourage us to take any field. Our job, our profession just demands to do a particular work at that particular time. Not really looking into that, but I'm sure they all are paid well. That shouldn't be an issue. And a profession dependent on relation with surgeon, yes. Which profession does not depend? Say, for example, a radiologist, if he is not good relationship with a surgeon, he may never refer a case to him. Similarly with any other field. So we need to be in harmony with each other consultants to not only to grow yourself professionally, but in your own field, you need to be recognized with your skill. You need to be good with all the other consultants. No patient base, no identity, those things are changing as I just explained to you. So in overall, I would say it's a beautiful branch. Whether you want to take critical care or continue only as anesthesiologist or follow up with DM and other fellowships, the options are wide open. And still, as I saw that not many had this first choice to opt, kindly guys do it, because I made the choice and I am very happy today, because at my rank, I would have got radiology also. So at 200, because radiology was beaming subject that time. And when I took anesthesia, my parents were like, what is this subject? They didn't even know what was anesthesia. So that way you take a subject which is in vogue, which is required, which has that appeal for next 20-25 years. That's never going to go down. And as artificial intelligence cannot penetrate here. So yes, you're saved with the technology there. So yes, good choice guys, take it.
Thank you so much, sir. Yeah, so how busy you want to be depends totally on you. For that matter, I am a dermatologist and I am not gone for a movie for the last 4 months. So it really doesn't matter. You can decide how busy you want to be. But thank you for such lovely insights on anesthesiology as well as critical care medicine. Not many know about critical care medicine as a specialty. And these were 2 points, I think, common to radiology and anesthesia, fields where junior consultant or younger consultant is often preferred over the older ones. They do a great job, they are updated, and they can do everything what seniors can do, but probably with slightly lesser pay. This was another comment that I got from some of the radiologists and anesthesiologists. But moving ahead, I would hand over to internal medicine to Dr. Nitin.
So how many of you want to do internal medicine first? Raise your hands. Right. So this is something that most want to do. The question you really want to ask yourself is, will I be able to do it? Right. So when you do internal medicine in a good college with a good case load, it is going to be tough. It is going to be very, very demanding as such. When I was doing my MD, there used to be every 3rd week, there used to be something known as double duty. So for example, if I go on Saturday morning, I used to come back on Monday evening as such. And you will, on your duty days, again, based on the center you are in, you may get anywhere ranging from 15 admissions to 35 admissions as such. And the only way you will be able to counter this is if you're passionate about the subject and you like the subject. I have had juniors, sometimes even colleagues who have joined in and they have regretted saying, oh gosh, what is this? We are just coming there, pressing the liver spleen, saying 5 centimeters, 6 centimeter, looking for that pallor, Babinski's sign. For what are we doing all this when you just can refer to a super specialist as such? So remember, especially if you're working in a multi-speciality institute or you're working in the city, in the future, only having MD medicine may not be enough. It again depends on where you're working. A super specialty almost becomes a necessity, especially if you're looking at scaling up in terms of quality of life and in terms of salary as such. The other slight disadvantage is, especially amongst non-medical people, you're never able to explain the concept of what MD medicine is, right? So whenever I used to go in a taxi, sometimes to a conference or something, the driver used to ask, "Kya doctor hai sahab?" Now when you say MD medicine, he doesn't understand. He says, Are you treating the heart? You'll say yes. Are you treating the kidney? Yes. Are you treating the liver? Yes. तो फिर क्या डॉक्टर है साहब? MBBS लोग भी ऐसा ही करते हैं ना. So the times have come that there is a sort of a blurring of gap between a non-medical or a general public's understanding of a MD medicine versus family medicine versus just being a good general physician as such. But again, like I said, all these things are secondary if you have that passion for diagnosis, saying that, yes, there's a patient in front of me, I want to diagnose what it is as such. And the advantage that is clearly written is you just don't need anything. Everyone talked about capital intensive and all that. MD medicine, you just need a table, chair, stethoscope, BP machine, and if you're good, patients will come to you. Because this is one specialty where it all depends on how you talk, how you're able to convince the patient, and how you're able to diagnose. You can go to the most corner of a village and you can still become one of the richest people, because patients will flock to you if you're good as such. So that's the advantage of internal medicine. But like I said, there are certain disadvantages, especially depending on where you want to settle and where you want to practice as such. If you don't want to do super specialization, you will have to develop some niche area, maybe geriatrics care, maybe some sort of, there are some certificate courses in endocrinology and diabetology. You will have to set up a niche area for yourself, even if you like being a physician as such. But otherwise, it's hectic. It's really, really arduous when you're doing it in a good place. And even if you're not doing it in a good place, the good thing about internal medicine is, if you're able to read and keep yourself up to date, you can come out of any place that you are in as a good physician, because it's just about seeing patients and learning from them as such. So I always say, and that's the right point, we can never have too many physicians. Even the surgeons like to be physicians at some point of time when they want to manage the electrolytes. Even the orthopedicians, everyone likes to be a physician, because that's what the typical image of a doctor is, being a physician or being a surgeon as such. So like I said, when you choose internal medicine, be ready for the hardship that you will endure for those 3 years. Later on, how busy or how lenient you want to be, or how chilled out you want to be, depends on yourself. You can also move into research and policy making if you do internal medicine, not just super specialization. And like Dr. Sandeep has done, internal medicine, infectious disease is also a very upcoming field post internal medicine as such. So internal medicine, lot of scopes, hard, but if you love it, that's the best love marriage you can ever have with Harrison's. Yeah.
Nice, nice. Thank you. Since the demand for internal medicine is very high, we call upon another internist, Dr. Sandeep, to discuss the challenges, his very own slide on the challenges being a medical specialist. In fact, he's the medical specialist for all my dermatology patients also. So, a lot of challenges we face together.
There are a few points I kind of agree with Dr. Nitin, and a few points I would like to differ there. While I finished my MD from Bangalore Medical College, the best thing of doing at such places of Bangalore Medical College, you'll have a lot of quantity of exposure to patients than the quality of it. 500 OPDs seen by a unit, many admissions. The moment the patient starts walking in, you would have written your prescription to send them out. So you lose patients. The quality of being very honest, you're being at the same place, sitting there a few years ago. So, but the quantity of the cases that you've seen in things gives you a different set of skills that you come out of this college. Secondly, when I finished my MD medicine and then I wanted to work, do the quality, do practice what Harrison mentioned. So I joined a corporate hospital, and then there are a few things, eye-openers, that I had the experience of working in a corporate hospital. Again, my passion was only for internal medicine, never wanted to do any specialization, because the whole concept of being an internal medicine, trying to connect the dots from A to Z, just fails when you start doing a specialization, unless you have a passion for each organ or the system that you wanted to do. One of the best advices that I got from these specialists was, Sandeep, stick to being an internal medicine, because I need a physician. And we need good physicians to take care of our patients. I may be a good neurologist. I still remember when I was doing my postings in Nemans, the best neurologist. We were doing rounds and he was just taking a history, and the moment the patient said, I'm starting to have fevers since last night, he used to turn around, where are the BMC PGs, where are the BMC PGs, and our collars would just go high. And I'd say, so, sight. Yeah. So that's how it is. So even the best neurologist would want a physician just because that's not his cup of tea. So all your specialties, you don't have to do a super specialization, but if you're good at your subject, you will be looked for, you will be searched for in your medical specialty. Yeah, you won't make as much as money as surgical fields. So my best advice is marry a surgical partner. So if anyone is in relationships already here now who's also seeking the same medical specialty, open your phones, message, game over, done, I'm breaking up with you. So it's not going to work. Simple reason, just walking out of, we're walking directly to here from my third-year daughter's birthday, and all bills are paid by my wife's bank account. I just have to take the tips. My bank account just took care of the tips for all the workers, but my wife, being a surgical field, she billed everything. So marry a surgical. Don't worry of the money. The money will come. You have your passion for. Yeah, the other points of no ability to pre-select your patients, you don't have to worry about. Limited work, all the other points can be changed. Medicine is always changing, so those points will become irrelevant as we go forward. Need to stay current, yes. You have to be on the top of the game. You have to make sure you keep your patients within your scope. Don't refer them unless you just need an intervention. You only refer to Dr. Govind only when I need a biopsy, otherwise treat it. So
yes,
just
so sometimes he even suggests the diagnosis. He says, I think he has a pellagra, can I have your confirmation? As like, I'm scared of such internists, you know, he will make me obsolete. So,
yeah. So again, the lot of political skills of being a medical specialist is actually trying to, because it's, being an internal medicine, you have to be in a team. You've got the entire team to work with. You've got your pathologist, the microbiologist. As an infectious disease consultant, I have to work with my microbiologist. I've got to have a team around me, whether it is my critical care medicines, my radiologist, my pathologist, my microbiologist. Every other specialty is embedded in internal medicine, and we've got to work as a team environment. And the last point, yes, every night you go, that's the debate that you're going to have. We'll be having our dinner dates, and I'll still be answering my calls from the hospital. There are times when she's walked out of my dinner dates and things like that. But so you have to be prepared for these events. So those are the main challenges of a medical specialty. But internal medicine as such has got the power. You can still stay as a medicine, but you have to be really good at what you do. You've got to stand out of the many physicians in your community. I still remember, I mean, if anyone from Dharwad, I've known a physician there, have got 200 OPDs per day, starts from 6 o'clock in the morning and goes up to 10 o'clock. So the patient walks in, he said, okay, Gutkoli, treatment. So there's absolutely no interaction with the patient, just listens to it, puts on a drug, and sends. Though there was no interaction, he doesn't like talking to patients, he just listens to them, puts in this one, and the patients are happy because the problem is solved. So things can happen that way. I'm a good speaker. The moment the patient walks in, first 10 minutes is all about their life, and then the complaint starts. So end of the day, whether I've just sent them home to get few investigations done, they feel 50% of the problems is solved. Like, oh, I'm done. I don't think I need these investigations. I'm fine, I believe, after just having a word with you. So you can have two different takes on how you want to present yourself to your patients, but you have to be really good if you want to stay as a physician. And I think we can never be obsolete anywhere we go. So the world needs a physician.
So you want to continue about pediatrics?
Pediatrics, again, referring to the points prior, just because you like kids doesn't mean you'll love pediatrics. Similar, I've spoken to you about how my pediatric internship was. Walk out for a cup of tea, come back in to see your kid being crashing out. I've had days of sleeping on the next patient bed, sisters just staying next to, not leaving the baby nest. I put a bed next to me, next to the baby, and I'm just sleeping there all through the night. So it's going to be a very difficult phase. And the main point in pediatrics is you're not just treating the patient, you're treating the parents. That becomes very important. The social aspects, your communication skills with the parents, because it's a very delicate set of population that you're dealing with. So if you've got the heart out there, if you've got the willpower to do it, go ahead. It's an amazing subject. You will also never, being in India, will never be short of pediatrics or the patients for you. So you will be in a very good set of patients, but you've got to have the guts, you've got to have the willpower to take up pediatrics.
And the only subject where you don't have to impress the patient, you have to impress his mummy.
To the extent, that I've had a couple of patients, who's your physician that you go to? And they'll be like, no, I actually just go to the pediatrician, and whenever I go, with my child, I just ask him itself, what I need to do.
True.
You will have some scope as a pediatrician.
So that's the best line, I feel. Invest in treating a child and you'll have a loyal patient for the rest of your life. And invest in treating children. And quickly talking about pulmonary medicine, which gained a lot of importance, especially in the last 3 years after COVID hit in. A lot of points are similar to the field of medicine. It runs in there itself. It is a specialty gaining a lot of demand. Respiratory diseases are on the rise. Easy to run a clinic, not much of an investment. Interventions are also not very expensive. Although the disadvantages, yes, you are the first in line for exposure to infectious diseases, including COVID, MDR, TB, and most of your cases are treated by good physicians like Dr. Sandeep sir itself. So why will he come to a pulmonary medicine specialist specifically? So your internist would treat a lot of cases. So too many referrals to a specific pulmonary medicine specialist may not be there.
I'll just tell one point here. These days, one of the most common symptom and which is the most difficult is doctor ee kem one tinglind hogtilla. The chem is just going on and on, and that's where a good pulmonologist comes in as such. So there is still a role of a good pulmonologist, because the way, the amount of time that they put in explaining about nebulization and the practice and the right way to do is something invaluable as such.
Thank you. So psychiatry, again, we don't have a psychiatrist on dais, so I will run through this slide. The advantages is, yes, brain and mind are among the final frontiers in science with unlimited scope for research and insights. You get to work on the human side, on the emotional side of, as well as the psychosocial aspects of illness. It is very intellectually and emotionally rewarding to see those patients do well. It is inherently multidisciplinary like most other branches of medicine, and a lot of collaborative teamwork is needed. There is a lot of unmet need and gap in the unmet need and treatment gap that is there in our country, especially with respect to psychiatry. However, you also have a good work-life balance in this field. The problems include that not only patients, even psychiatrists face a lot of stigma and discrimination from fellow physicians. In fact, I've heard from psychiatrists that it's very tough for them to find a life partner. Not very easily do they get life partners being psychiatrists. May not be everyone's cup of tea, requires skill set of talking and a lot of openness of mind. Can be emotionally very draining to see so much of suffering, and having good teachers and training institutes in this specialty is kind of tough, and to find very good teachers who are passionate, who can cover the length and breadth of psychiatry may be tough, and may not be very financially rewarding either. So coming to the surgical specialty that Dr. Sandeep married, Obs and Gynae, Dr. Pratima, if you could.
Right. So how many of you want to take obstetrics? Okay, I can see some male hands also going up. That's very, very good. So as Pratima here said, there's no gender bias anymore. See, obstetrics and gynecology is going to be together for a very long time. So, obstetrics, yes, you might initially feel female patients, they're not very, really very, they won't let you see and all that. That might still be there for a long time. I'm not saying that it's going to go away. But other than that, obstetrics is again not an end specialty. There's too many super specialities in it again. Laparoscopy surgeries have taken over the whole gynecology part of it. So endogynecology is a very happening subject right now. And many male, people who take obs and gynae go to gynae. They leave obstetrics, they say, okay, females don't want to come to us for delivery and stuff, but they do come for their hysterectomies or fibroids or endometriosis. So there's lot of scope for endogynecology. Office hysteroscopies, interventional hysteroscopies, laparoscopies, robotic surgeries. Gynae-oncology is again another field where more male surgeons are putting their hands into. And as I said, there's something which is very appealing about the subject of seeing nice newborn chubby babies coming out and crying happily in your arms. I don't think there are very few subjects or branches which are going to give you that feeling. Yeah, you can see me after 72 hours of shift in Vanivilas Hospital. Yeah, I was very thin then because I lost all my weight. And that was the first set of triplets I delivered, and it's just vaginally, mind you. And it's just so ecstatic to do that. And I did it again after a month. That can happen only in Vani Vilas, I guess, right now. So it was just absolutely thrilling. And you will fall in love with obstetrics, even if you went rather reluctantly. Advantages, I would say, it's one of the branches of medicine where you have equal surgery and medicine to it. So you're not going to forget your medicine being a surgeon, and obviously you're going to be operating every other day. Disadvantages, yes, very stressful life, they would say, because especially with obstetrics, you're always treating a family, I would rather say. People say you're treating 2 people at once, but I would say you're treating a family, because there's a lot of anxiety with the coming of a new member of the family, there's a lot of stress, and anything can happen in obstetrics. A patient whom you never imagine will have complications might just bleed out, and so a lot of adrenaline rush, a lot of dopamine rush, a lot of stress nights. You will definitely have to wake up in the night and go. So these are the factors. If you feel that I'm not up for it, please don't take this. This is not the subject for you. And again, yes, it's rewarding, and when Sandeep, married me because it's a surgical branch, so that you can compensate. So I took up obstetrics after giving so many entrance examinations. One of the major facts he said was, I am taking medicine. I am in love with medicine. So you need to take a surgical branch because we need to compensate for things in our life. So as a dutiful wife, I said, okay, let's do that. But there's a lot of new ventures. It doesn't have to be very hectic, There are some subspecs which you can do. Fetal medicine, then you can do IVF. So then your working hours could be much more regulated. Then it doesn't have to be very hectic and you get called any time in the night. It's not so much. You can still regulate your practice. And the branch I have chosen, urogynecology, I don't know if many people here know what it is. It's a very happening branch in UK and other places overseas. So you do all the incontinence procedures, incontinence surgeries, prolapse surgeries, perineal tears, vesicovaginal fistulas. Again, it's a branch which is quite male dominated in other countries, but there's no gender bias. I would say there's no gender bias as long as you are interested in it and as long as you can communicate efficiently. And as I said, you will not forget either your medicine nor you will forget your surgery. So if you want to do both, it's the best branch that you can take.
Thank you so much, Dr. Pratima. And coming to my favorite branch, dermatology, and I would like to tell more points on your completion. No, of that specialty. Please, sir, you.
No, go ahead. I'm telling you one of the dermatology. You'll see all excellent points what Govind
No,
is going to
no.
tell.
So
I know.
my guru will be talking about
More.
dermatology. Sir, I would want your views on advantages and disadvantages of being a dermatologist or taking up dermatology.
Dr. Pratima is assured of 50% of the population as her patients. All ladies are her patients right from the day they are born till this thing there. Females are always their patients. But if you want 100% of patients, 100% of the population to you, be a dermatologist. Right from pediatric age group till the geriatric age group, dermatology, skin being the largest organ, apart from, of course, the vascular structures, skin is the largest organ in the body, and so you'll have problems, skin problems in some, depending on your age, some skin problems will be there at every point in your life. So that way, dermatologists, there are no dearth of patients at all. You can earn a lot. If you want to be a physician, you want to be Sherlock Holmes, you can become a dermatologist. Because it's all about diagnosing your skill, and your skills come to play here, because the more you see, the more you learn, the more you memorize, the more easy it becomes for you to diagnose in cases. Because there is a visual branch. Unlike any other branch, this is the visual branch. You need to memorize. You should be good enough. A detective has an important role. More so, most of the times with the rash and any other systemic illness is there, it is the dermatologist who diagnoses cases. Dermatology is skin is a mirror of internal diseases. So many of the times we diagnose and then send it to the other. Maybe it's a physician, maybe a surgeon, maybe a orthopedician, whatever it is. It is only dermatology textbook which has got chapters with every other subject. Dermatology and orthopedics, dermatology and internal medicine, dermatology and surgery, dermatology and this thing. So you have, it's all encompassing. Why in the last few decades, maybe in the last 2 decades, dermatology came to the forefront is because more and more girls came into medical field now. I think 60 to 70% of seats are always taken by girls. And many of the girls, they used to marry busy physicians, busy surgeons, busy orthopedicians, right? So they wanted to have a good life. If you want to have a good life, if you want to have a fixed and flexible life, choose dermatology. If you want to earn well, yes, choose dermatology. If you want to be a surgeon also and being a physician, choose dermatology, because cold steel surgery is now in dermatology. We are doing flap surgeries, we are doing most of the beauty surgeries. And of course, if you want to use a laser, you want to go to the technology side, use lasers, again dermatology. So it has got every other attraction it has got. You can earn money, you can have a good life. And the most famous adage, everybody thinks, dermatology, no emergency. You have emergency also in dermatology. When you take drugs, you have drug reactions, you have bullous diseases, you have toxic epidermal necrolysis. So much so that in Victoria Hospital, I established the first ICU, dermatology ICU. Of course, it didn't continue for various reasons, but we had established and we had patients, just to drive away the myth that dermatology has no emergency. So I was fed up hearing that for a long, long time. I said, yes, we have emergencies and we used to treat cases on an emergency basis. So you have emergency, you have fixed time, you have good earnings, you have the best of life, and you can be the best partner to your busy husband, or vice versa also, and be a dermatologist.
Thank you, sir. Thank you so much for covering everything. And thank you for impressing upon the subject onto me so much that I took it up as my career as well. Thank you, sir. So, yeah, that's one of my pictures when I just completed my postgraduate and did a fellowship in skin laser surgery at Mahidol University. So we have talked about your dream branches, but everything is not so dreamy. We'll be going a little bit to the slides which I skipped so that we can talk more about the branch. Now coming to specific questions, okay. MDMS versus DNB and MDMS versus diploma. Now this is a very genuine doubt in the minds of a lot of students. I am getting a DNB seat, I'm not getting an MDMS, should I take it? I'm getting a diploma seat, I'm not getting an MD, should I take it? So the whole reason that I have invited such a wonderful, vast variety of a panel is they have had experiences in answering all these questions. So firstly, I would ask Sachi sir itself. Sir, please tell us about the facts about doing a DNB course, how far a person can go in their career. Is doing a DNB a roadblock to them in any way? Your views, because you've been at the level of a dean, vice chancellor, HOD, you have recruited people, so nothing speaks more than your experience, sir.
I think the second part of your question is irrelevant now. Diplomas have been already done away with. We don't have diplomas anymore.
Few seats.
Very few
seats,
diplomas have, and they'll be phased out. So MD or MS or diploma doesn't come to question at all. Now MD/MS versus DNB. It took us so many years because DNB is also established by Act of Parliament, National Board of Examination. So whatever they conduct, whatever the exams they conduct are all relevant. But it took us a long 4 to 5 decades to equate DNB with MD/MS. Be rest assured, and there are so many panels here who are also DNBs. Today, DNB, if it is done in a 500-bed hospital, is equivalent to MD/MS. That means when you get a DNB in any specialty, you can directly become an assistant professor, provided you have done 1 year of senior residency. So there is no, the only difference between these two are DNB could practice anywhere in India, the specialty has chosen, but they couldn't become teachers. They were discouraged from becoming teachers, but now it has been settled. If they have done DNB from a 500-bed hospital, it's equal to MD/MS, and they can pursue academic career also. So that is the advantage you are having over DNB. And of course, if you have not done DNB in a 500-bed hospital, you need to have an extra, that means 2 years of senior residency to equate that to MD/MS. So that being the case, you need not worry at all. If you don't get, of course, what happens is very few of you would choose DNB directly because MD/MS is very popular among the masses. The patients understand that if you are MD/MS doctor, you are a real doctor. If you say that you are a DNB, the patients won't understand that. That's the only difference. Whereas in medical fraternity, the difference between MD and DNB has already been settled. We understand that DNB is important and as equal as doing MD/MS. So it's only in the eyes of the patient, and in very few years from now, they'll also understand that DNB is also equal to MD/MS, right?
Thank you, sir. So before we continue with this topic, Dr. Kishore sir has a flight to catch, so he'd like to take leave. Thank you, Kishore sir, for being here. And all those who want to connect with Kishore sir, you can contact me. I will help you with his email address. Thank you, Kishore sir, for sparing your time. And Dr. Pratima also needs to leave due to her prior commitments. Thank you so much, Dr. Pratima, for being with us today. Thank you, sir. Thank you, Dr. Pratima. Going on with the session, yes, Dr. Nitin wanted to make
something very important to consider about from what Sachidanand sir has also told is, it is okay to, and it's sometimes maybe better to do a DNB in medical specialties in hospitals which have very good patient load, because as compared to certain medical college, you might have more facilities in terms of investigations and all to do. When it comes to surgical specialties, be very, very careful about choosing DNB because it's more hands-on and you need to ensure that adequate hands-on opportunities are given. But actually, going by last year's trend, DNB is also becoming more popular and more students are taking it because of simply one important reason, and that is the finance. Your MD/MS seat in a private medical college goes up into lakhs. Your DNB for the entire 3 years comes to 3 lakhs. There is no bond. You get stipend equivalent to the government thing. So when you look financially and from the point of view of a bond, DNB makes much more sense rather than MD/MS in today's time.
Some hospitals have bonds, but yeah, you can find out before joining. But yes, compared to other states, yes, the bond thing can be looked at, but they are very valid points. So the point here is, if you're sure about the branch you want to take and you do not want to compromise on your specialty, then definitely you can consider taking DNB as a course. Any other panelists? Dr. Deepak, you have done DMRD and DNB. Any kind of problems you have faced in your career because of DMRD, DNB, or any points you would want to
Yeah,
make?
but sir clarified on that aspect because 5-6 years back there was a lot of confusion whether you can get into a teaching college after doing DNB. So there was a lot of confusion whether you'll be promoted to associate professor, how many years of SRship you need to do, or will they recognize or not. So there was a lot of confusion. Each person used to come out with their own rule during each MCI inspection. So now that rule has been clarified and it's very clear. So like sir told, if you have done it from a 500-bedded hospital, you are treated equal to a MD. So when I finished it, there was a lot of confusion, so that's why I didn't opt for the medical college at all, because I saw my friends getting stuck in it and trying to come out of it itself took 4 to 5 years actually, so that they got to be recognized as a SR and then be promoted as an associate professor. One other thing about DNB is, in especially radiology, is you get to do it in one of the best setups, because at least like nowadays all the government setups are having good machines put up in their departments and everything. But 5-6 years back when I was doing, it was mainly the private sector which had the best setup and who had the expertise for radiology, a little more exposure and better expertise. So at that time for me, doing a DNB was more vital because it was academically very helpful actually. But now most of the medical colleges also do have very good machines being set up by the government. So looking at the things in the past 4-5 years, things have changed now. So it does not matter much if it's a DNB or a MD, as long as they have all the requisite machines, the good ones, and the required faculty who are expertised in all of them. I think it should be any good place, either MD or DNB should be good enough to select.
Thank you. Dr. Nitin has to go for his hospital rounds as an oncologist. Thank you, Dr. Nitin, for being with us and gracing us. Again, if there are any of the panelists that you wish to connect to, you can connect through me. I will give you their email addresses. Thank you. Thank you, Dr. Nitin, so much for sparing time. So, coming back to our older topic of how to select a branch. Also, if you're confused about selecting a branch, you're not able to choose, we spoke about, deciding, ruling out a particular branch, so please make sure that you have ruled out particular branches. And this is another question we spoke about the spouses on stage, but should my life partner belong to a particular specialty? Yes, you can have a good combination of medical and surgical specialties, but anyone on the panel wishes to make a statement on this, wishes to say anything more about. I've had patients who, I have had aspirants ask me, should I marry a person from a particular branch?
I would take that.
Yes, sir.
How many of you in the audience want to take a preclinical and paraclinical postgraduate? I am really concerned about this because as a medical education administrator, we need preclinical and paraclinical subject postgraduates also. The government has opened almost around 300 medical colleges in the last few years. You are all aware of that. And most of you are the beneficiaries of that because the number of seats went up substantially. You have become graduates, you had the opportunity to become undergraduates, and now you are at the verge of becoming postgraduates. The postgraduate seats are also being increased. But imagine a new medical college cannot be started without the preclinical and paraclinical subjects. You don't have teachers at all. In the last 10 years or 15 years, all the seats are going vacant. Barring pathology and community medicine, the other subjects are all going vacant. That's a cause for concern for me because as an administrator, I would like to look at that. It's very difficult to, So here, for such of those, be it a girl or a boy, if your partner who are chosen is a busy physician or a busy surgeon or anything, you should take up pre and paraclinical subjects because you can have that 9-to-5 job, get into a medical college and be very comfortable with your life. Because the other part, your life partner is taking care of the rest of the things. So I would suggest, please take up pre and paraclinical subjects if you are choosing a life partner who is going to be a busy practitioner, right? Thank you.
Thank you, sir. Dr. Sandeep?
I completely echo sir's opinion on that. I had friends, school friends, whose both parents were doctors. So when I entered medical school, my goal was to marry a non-medico. For the simple reason being, for the family. Now, exactly when you're looking at this point of time, all your priority is your career. You're not thinking of the person sitting next to you, who's your parent. If you ask what's their priority, career is not their priority. You are their priority. That's the reason why they're sitting next to you, listening to us, rather than still working at their office places. Because the priorities change. We at this point do not understand it, and I've been on exactly in the same point where I never understood about those things. Now that I have a 3-year-old daughter, now we are making huge changes in our lives, in our career, to make sure she does not misses us. That there is a father or a mother exactly at her request any time of the day. She being a gynecologist, obstetrician, she can have an emergency call at any moment of time, even in the middle of the night. So I make sure I stay next to our little girl, saying that at least Papa is just sleeping next to me, or things like that. So it just becomes very important that who your partner is. We're not here thinking of that. But in your plans, this point should be there about how my future life is got to be, because it just becomes very important. I've got many of my school friends, both parents are doctors, busy doctors, and they've had a life where anything that they want to share to is their close friends. They've never shared anything to their parents. The parents is just another strange person in their lives. And we made sure that we took up the oath that we're never going to do that for our kids. So it just becomes very important, because right now your priority is career, but as you keep going up, then the priorities change, and then you can't undo the decisions that you're going to make right now. So it becomes important of choosing your life partner, though it might seem meaningless, but please, please, please take that into consideration.
Thank you, sir. Yes,
Govind,
sir.
we should have had a panelist from pre and paraclinical subjects also.
Yeah,
that would have been added much to.
Again, for echoing sirs, clinical microbiologist is now next, the big thing that's happening. Please don't think microbiology is going to just within the 4 walls. They're coming out to the bedside. At Ramaya, I have got an amazing team of clinical microbiologists where I take the decisions with them next to the patient. I take care of the clinical symptoms, the signs. I make a diagnosis, a clinical diagnosis, while they give me a laboratory diagnosis. They come, they look at the clinical patient, they understand what cultures need to be taken, how the samples, which would be the best sample, and which would be the right organism. So microbiology is booming up. Pharmacology, the next era of therapeutics is monoclonal antibodies. And a pharmacologist, we require a pharmacologist. It's not just preclinical and clinical all the way in the future. It's going to be the paraclinical. And if you're not very sure, as sir mentioned, I'm going to get a spouse who's going to be a busy neurosurgeon or a cardiologist, then take paraclinicals, 9 to 5 jobs, but you're going to make it big in the years to come. Your long-term goals, you will be the most sought out person in the pharmaceutical industries and the clinical microbiology teams. So paraclinicals are coming up next. I still remember when I was in UK, the surgeon, before he starts the incision, an anatomist should give the incision mark based on anatomical lines for the best healing of post-surgically. So unless an anatomist comes and says this is where the incision should happen, the surgeon is not going to do. So paraclinicals, there is a lot of future ahead. Please don't disregard it.
Sorry, just to add to that, just a little bit of experience for the 2 or 3 years having worked in the NHS. Our rounds would be incomplete without a clinical pharmacologist tagging along with us. Sometimes it would be a little irritating because everything is on the system there, nothing is written on the charts. So once some patient gets admitted, I am a gynecologist, what do I know about what tablet she's taking for asthma? But everything had to be entered, and the dosage and everything. So it was their job. They used to come and make sure all that has been entered. Otherwise the patient wouldn't get any of their regular medications when they were admitted under us. As well as some, you know, as in gynecology, I said you will never be able to forget medicine. Okay, your lady you have admitted, she has some very rare disease for which she is taking some rare drug, you don't even know how to spell it. how are you going to write the dosage and everything for it? So always the clinical pharmacist used to be there telling us, and we work long hours, and there's always a chance that we make mistakes in our prescriptions, or we write the wrong dosage or the drug. We don't check the allergies properly. So they used to always be behind our back to make sure that such errors didn't occur. So that's a really great blessing. And I think most of the corporates are including that as well now. So clinical pharmacist is really, really important part of our team practice. As I said, there's no individual branch anymore. Everybody is doing a teamwork and team practice. And as well as, you do your post-graduation, and doesn't mean you're going to be here for the rest of your life. Things change, avenues change. Not all of us are going to marry doctors. You might have married some other person who's going overseas for some other reason, and you might need to change. And in other countries, these branches do have a lot more value and pay as well, to be honest.
Thank you, Dr. Pratima and sir, for all these values. In fact, on a lighter note, the other day I was discussing with a PG aspirant, and he's like, ಅಯ್ಯೋ ನಂದೇ ಬ್ರಾಂಚ್ ಸೆಟ್ ಆಗಿಲ್ಲ, ಅವಳದು ಯೋಚಿಸ್ಕೋಬೇಕಾ ನಾನು, ಇಲ್ಲ ಅಷ್ಟೆಲ್ಲ ನನ್ನ ಕೈಯಲ್ಲಿ ಆಗಲ್ಲ. ಬಟ್ ಎಸ್, ವಾಟ್ ದಿ ಪ್ಯಾನಲಿಸ್ಟ್ ಸೆಡ್ ಮೇಕ್ಸ್ ಅ ಲಾಟ್ ಆಫ್ ಸೆನ್ಸ್. ಡೂ think about it at least in the back of your mind. Okay, so this is another important point when parents come to me along with the aspirant to discuss their field. Many times the parent wants his or her son or daughter to take up a particular specialty. Peer pressure or pressure of the partner to take up a particular specialty. So any thoughts on those? Panelists would want
it's
to.
Something like this, politician's son should become a politician. That's what is happening in election time now. You're seeing the scenarios enacted. Doctors' children would definitely, there are 50-50 decisions made. Some of them do not want to become doctors at all, seeing their parents' plight, getting up in the night, going at whatever time they are called for. Those thought of life, many children don't want, they become engineers. But there are very large number of children who have taken up the same specialty as what their parents have taken up. So both ways it is fine. But it is the passion ultimately. I'll add one more P to that, that is passion of the individual. Whatever he wants to pursue, please pursue that. Whether it's preclinical or paraclinical or clinical, you're still going to be a doctor, you're going to be recognized as a doctor in the society. And I'm not trying to request you to sacrifice your passion of becoming a clinician and then becoming a preclinical, paraclinical just because. But as a medical education specialist, I am concerned that in future, what is the fate of the medical colleges if all the existing assistant professors, they become associate professor and professors, who's going to man the large number of vacancies that are going to arise? I'm just concerned about that. Thank you.
Thank you. So my basic point here is, do not take up a specialty just because someone else wants you to take it up. Please make sure you have your heart in it. Also, what is more important? Should I take up ENT in AIMS, which I don't like, ENT I don't like, or should I take up dermatology in BMC? AIMS is a better college, but dermatology is a branch I like. AIMS is a better college, BMC is not as good as AIMS. So there's many people ask practical questions actually saying that, should I give more importance to the college or more importance to the branch? I think our entire discussion has brought light to the point that, the branch that you like is very, very important. That is the ultimate thing that you'll be in this college only for maybe 3 years, 4 years. It may make you better at the branch that you selected in that college, but do you really like that branch? It's just the debate between a beautiful spouse who's not very nice as a person, or a very nice spouse who may not be very beautiful. So that's the other question. And moving out, we are almost coming to the end of our seminar. So just a couple of, so before I give my closing remarks as a moderator, I would request those on the dais to give their closing remarks, starting from Dr. Deepak.
I think by now we all have understood one thing for sure, that just follow your dreams, just follow what you like. So it might not be in the college you like, but again, if it's the subject you like, take it. Because there's always a lot of avenues, because just doing the MDMS is not the end of the road. So the actual story starts after you finish. So after your PG, where you work, what you work, the next 3-4 years, what you gain in your experience is going to settle for you for the rest of the life. So what you do, not just during your PG, post-PG is also equally important the next couple of years. So just don't get disheartened, I've not gotten this college, but just pursue whatever you want, the passion you want, the subject you want. And if you're not happy with whatever you have gained in that place, go and work in a nice place later on. It actually adds a lot more to your profession afterwards.
Thank you. So branches, almost all branches, we discussed a lot of disadvantages. Almost all branches are headed with problems which are quite common sometimes, like gradual saturation of certain branches in metros, need for an extra degree or training to establish in a big city. Earnings will always come to a ceiling at some point, and there is going to be change in demand and supply ratio in cities, in towns, which you will have to, but these are dynamic changes which are for all specialities and maybe all professions. So I think this is not something that you should really worry. You should think about keeping yourself abreast, keep yourself updated. If you're not updated, then you will be replaced by someone else who is. Okay. Also, by and large, the advantages and disadvantages between medical versus surgical specialties will linger around to be similar. Okay. So with this, we'll ask for Q&A directly from the people on the dais and my dear aspirants. So if you have any questions to ask any of the panelists, now is the time. You can directly ask them. I know a lot has been discussed. So before we close the session, I would encourage questions from the students, their parents. Yes, the gentleman in green. Can we have volunteers with the mics, please?
Good evening, everyone. It was really nice to hear your experience and tell your the prospects in each of these branches. But I feel like some of the things are being talked superlatively, like the other other career options other than going clinical or non-clinical, like in medical legal aspects, or there are some branches like biotechnology and like I heard about this MMST course in IIT Kharagpur and all. Any idea about those prospects in those fields and how to get into that?
Sachi sir, I think you have spoken about this. Sir would be the best person to talk about this.
Yeah, doctors pursuing other courses, other career paths. That's what you want to know. Yeah. Government of India is now thinking of, please sit down, thinking of IMS, that is Indian Medical Service. Whether it's going to be reality in a few years from now is the question we have in our mind. But if it comes, Indian Medical Service will be very attractive. Most of you who have got that flair for administration can take up that. But it may not happen to your batch. You don't have that option right now. It may happen in the future. So doctors can pursue a career as an administrator. They can pursue a career as a researcher. Now, Indian government has set aside 20,000 crores for research projects. So there is a very, very big scope for you becoming researchers. You can get into that field, R&D field. Then you can also become, you can become entrepreneurs directly. There are many doctors who have left medical profession but become entrepreneurs, and they have employed many doctors and running good hospitals. That also can be done, provided, of course, you have the resources and the flair for that. So there are many other paths that are available. You can not only be a medical profession, but being a medical profession, you can also do other career paths also.
For example, I know the last 2-3 students of mine who have a craze. I've done an MBBS, but I want to become a medical legal expert. So obviously after MBBS, a lot of people may laugh at them. But when you see years later, they are most in demand. But you have to really put your double mind, because after doing MBBS, you jump and do LLB and then LLM, then you have to have a really mastermind. Though the clinical field, what you're doing it, but when they will fall in trouble, they will come behind you, and then that is the time you charge more. But one thing which I didn't know, I hope not, if you complete your MBBS or your MDMS, and then you think I want to become a medical legal expert, what I got to know is that you cannot practice medicine. You have to stick it to the law, is what I've been told. Earlier we thought, oh, I can do this also and that, but apparently it is stated that you can't. You have to submit that and you can do only one practice. Yes, you can't do dual, is what I got to know. So confirm before you do, but there are people who are jumping in medical legal thing because it is upcoming like anything, and you always compete to a better lawyer, however good is. Once you have an MBBS knowledge, a medical, you know the terminologies, you can find out, and a lot of rules are coming up. There are people who are jumping and doing hospital administration, and not only here, after doing hospital administration from one of the top colleges, they move out abroad. They learn and they do something different also. So prospects are there, you need to know how to do and how dedicated are you also in that. But it requires a real guts.
Thank you.
Thank you, sir.
Questions from the audience? Yeah, the lady in orange.
Hello. It was very inspiring listening to all your journeys. I just wanted to know scope of emergency medicine. MD emergency medicine has come up recently.
Yes, I think Dr. Kishore sir elaborated, and yeah, Dr.
Like Dr. Nitin and Dr. Kishore are one of the two colleagues of mine who know their work is emergency medicine has come up drastically. Okay, as well how critical care medicine has come, the same thing emergency medicine has come up into the picture. Earlier, like some of the institute where we have worked, like St. John, CMC, all of them had a fellowship. But off later, they are looking of converting into MD and DNB emergency medicines. Yes, if you do a DNB emergency medicine and you go abroad, you are in demand. But a new rule has come that a lot of corporate hospitals are pushing emergency medicine to be a priority because one of the requirement is there in that. And the demand is really booming like anything. So you can add on this?
Yeah, realizing the potential for emergency medicine, the National Medical Commission has made it compulsory to start emergency medicine department in all the medical colleges. That's one thing. Secondly, the development, India is in a very fast track development. We have good roads. Travel is now very easy. Of course, that leads to many accidents also. So emergency medicine is a must in all the highways, wherever medical colleges are there, and it's compulsory to have that. So a lot of scope is there for emergency medicine.
Thank you, sir.
Good evening, sir. In fact, I have no question. The seminar is, very well organized, and the various inputs given has enriched my knowledge, and it has clarified a lot of doubts in our minds regarding which course my son has to take. So I thank Medical Mentor for providing this opportunity for enriching my knowledge. Thank you very much.
Thank you. Thank you so much.
As sir has said, critical care medicine, emergency medicine, family medicine, those subjects are coming like anything. So that's why I said geriatric medicine, all of them are having. So always just don't fix with medicine surgery. Look at the trends and how it is changing. And just not India. A lot of people are saying what I can do in India and what is the demand abroad. And that's how they even plan their career.
I would also like to remind you all, doing post-graduation is one step. There's another step after that. Either you have to do a super specialty, because it's I don't call it as a rat race, but it is a competitive field out there. You need to be better than or something distinct from other colleagues of yours. So you need to specialize and super specialize in something else. To just take the example of dermatology, because I'm a dermatologist, I can give that example. Today, dermatology has been, again, hair has been split. We have dermatopathology, we have pediatric dermatology, we have aesthetic dermatology, we have dermatosurgery, dermato-oncology, photodermatology. All these specialists have come up, right? And trichology. So you can be a dermatologist, but you can also specialize in something else and be distinct from others. So that you have to be prepared, because it's a long journey for you now, from now on also.
Thank you, sir. Any more questions?
Sir, I had doubt regarding Dermat.
like it's going more towards cosmetology. So if I'm not that interested in doing cosmetology, I'm just interested in doing basic dermatology. Is it fine to take?
Fantastic.
It's always there. Clinical dermatology is the basis for all cosmetic dermatology also. You cannot get patients directly for cosmetic dermatology. They have to be picked up from a clinical dermatology department itself. So clinical dermatology can never die. It's only your interest. As I said, you can be basically a clinical dermatologist, but also have a little practice of aesthetics if you are interested. Otherwise, it's always there. Pediatric dermatology is a pure clinical dermatology subject, right?
Thank you.
Okay.
People are even becoming dermatosurgeons. You know that, no? After dermatology, they want to learn surgery, and that's why they become dermatosurgeons. People are becoming dermato hair transplant, only being hair transplant. So you have a lot of options.
So, yeah, please.
Yeah.
Hello. Good evening, sir. I had a question. What are the prospects after pulmonary medicine?
You'd like to take that, Sandeep, sir?
The prospects of, it'll be interventional pulmonologist. One, sleep medicine is booming up with obesity becoming the next pandemic within our country. So obstructive sleep apnea is being both shared by the ENT specialist as well as the pulmonary medicine. So sleep specialist, interventional pulmonologist with all the bronchoscopies, video-assisted thoracoscopic surgeries, and right now, as we are speaking, the lung transplant team are starting up. We've got a lot of patients who need lung transplants, and centers are propping up. One of the main centers being Narayana Health City, the main branch. So huge scope for pulmonary medicine team following their post-graduation. So yeah, critical care medicine, again, it becomes very important. Like some people have done MD pulmonary medicine and then going to critical care. So that could also be done, but I think a lot of pulmonary medicine, pulmonologists are looking at interventions and lung transplants.
Thank you.
Good evening. This is here.
Yes, sir.
Okay, first of all, I would like to thank panelist, doctor, and moderator for this amazing session. So I don't have any background of medicine, but nor my family. But in this short 1 hour session, I think I understood a lot of it. So thank you for that. I have one question. One thing coming out very predominantly that you need to go through your passion about the branch you want to go. So for what is your advice for a student who is not actually scored well this year? Is he need to wait for 1 more year and pursue it, or he can actually go for option B and then excel in that as well?
So actually I had made a slide on this. Should I take a drop this year or not? Because of interest of time, I actually skipped the slide. Any of the panelists would like to talk about, should I take a drop this year?
Till last year when I was a professor, I think I would get almost every month 3 or 4 calls, okay, what to do about it. And just 2 questions on that. How confident are you of your passion? Sir, I want to do this only. Fine, you can drop 1 or 2 years. Sir, I like it, I don't mind it. But anything is fine with me, you can take a call of it. So the depth of your passion is important. No, sir, I want to do medicine, or I want to do dermatology, and I really want to work. Nothing wrong in dropping 2 or 3 years, because your rest of your 30 years is based on this. But if you are like, okay, sir, it's no issues or nothing like that, I'm flexible, like arranged marriage, 1, 2, 3, be Rajesh Khanna, choose, if not this, that, if not that, choose whichever you like it.
I would like to answer this from the parental point of view. I'm a father, I have 2 children. Both of them have completed MBBS and they are pursuing their post-graduation. One is a girl, one is a boy. My perspective would be different with both of them. You may differ, but this is what, as a parent, I would think of. My priority for the girl would be to take up post-graduation immediately after internship. Most of the children, most of the doctors who undergraduates, they can give their best shot at the end of their internship because you are fresh. You have studied all the subjects, you have gone through it, you maybe have also gone through the NEET coaching. Your best performance would be the first performance that you give, right? Of course, you fall ill and then something happens in the family, you may not be able to do well, that's fine. That's a very rare case. But the best shot is given then. But most of these undergraduates, they want to drop that year. They want to make a trial for the first time after internship, and then they want to make a best effort in the next year. You're losing 1 year. But as a parent, I'm concerned. I don't want my children to lose even that year. They should get post-graduation immediately after finishing their internship. So this is what is important. You should give your best attempt, best foot forward immediately after internship. That's one thing. Secondly, my priority is if I'm for the girl, I want to see her married off. Because as age advances for the girl, it becomes difficult to get a boy who is more qualified than her and at a senior person, at least by 2-3 years. So the choices become less for the girl as age advances. 1 year, 2 year matters a lot. So this is what every parent would be thinking. They want to finish the girl child to finish her post-graduation as early as possible and get married. Okay, this is my concern. The boy can wait and take 1 more year. He can drop and take 1 more year.
I would kind of differ from this a little bit. But sir is talking from a parent point of view. I have still not reached there, so maybe it is...
I also would like, with due respect, sir, and for all the parents, I would request all the parents to let your kids take the wings, let her grow. I know marriage is a very important aspect in their lives, but please do not make it a point in deciding a specialty or a subject.
I told them to read and get the subject.
See, I always felt 1 year, 2 year, if you drop down, please don't take it into perspective. We always look at long terms. Have an idea in 10 years of life. You'll have your peers taking up seats, but you still are behind. They have taken a seat. In that pressure, you're like, okay, let me select a seat. But 10 years down the line, that's where it is important of where do you stand in the society along with your peers. Not the first year or the second year. Every person is different. I might be a slow learner. My friend would be a fast learner. I might take 2 years to get what I wanted in life. He or she might just take 1 year. But 10 years down the line, 15 years down the line, that's where it becomes important of where you stand among your peers, among your specialty. At your 15th reunion year, then make sure you walk into your reunion felicitation or in a Mercedes car or a BMW. That's when it matters. Not just first year. Sincere request to everyone, just don't falter just to get a seat just because you've been pressurized by the parent or a peer or a friend, a neighbor or your aunt on a marriage. Inna nin magal seat siklilva anta. We had stopped going to all functions and things during this tenure of hearing the same questions again. Inna seat siklilva. Inna uttidala anta, Alex. So
I think we need to put this a little bit in an objective perspective where check whether it was the first attempt. During the first attempt, was the internship going on? Was he or she able to give the full preparation that NEET wants? NEET is a very competitive exam, a very, very competitive exam. You have to read 15 plus 4, almost 19 subjects.
Nobody does internship nowadays. They only read for NEET.
I agree, sir, agree. But even in my batch, there were a good number of us who said, in fact, now I come from a non-medical background. I wanted to attend each and every internship, the posting, because tomorrow if the neighbor asks something about ENT and if I don't say or don't write, or if they say this lady is pregnant and she's vomiting, which medicine I can give, and if I didn't attend my OG postings, I would not be able to answer
That's
it.
only for 1 year. You're going to be a postgraduate later on.
But if I don't answer a simple question, so I mean to say it is important to be in your internship, give full attention to your internship during your MBBS, and in fact as the next exam is going to come up, the next exam, internship will gain
No,
more.
I don't subscribe to the idea that I'm doing internship so I can't study for NEET. No, you have to do both. You're expected to do both. And already you have gone through 4.5 years of medical course. You have studied all the subjects. You're supposed to be knowledgeable, you are supposed to be updated. So you give your best shot.
Sir,
when
the
you are in
approach is different.
No.
The approach is
Dr.
different.
Govind and Sachidanand. See, students start preparing from third year only. This fight is unnecessary. See. No. What is happening? They are concentrating more on NEET exams.
Very true, sir. Very true. Very true.
We will drop this for the moment and leave the parents, and each case is individual, I feel.
True.
Because
Very true.
that family has to decide. Not myself, not Govind, not Dr. Sachidanand, not the panel. It is the family who have to decide. And it is the person who has to take that call. I don't think it can be generalized. And such is concern I appreciate, because as a parent, you have lot of responsibilities.
True.
You may think it is so easy, drop 2 years, then search, you'll get somebody. It's not so easy in the context at this point of time in India. See, foreign countries, it's a different issue. See, they do lot of other things. At the age of 35, they join for MBBS or MD, which cannot happen in India. So I don't think we should discuss that. Encourage your boys. If they are very passionate, you have to decide. Nobody else can take that call.
True. So it's a multifactorial thing, as we have viewpoints, differing viewpoints in the panel itself from Sachi sir, me. So whether you can afford a private seat, do you have support in your family, do you have to support a family as a PG, what are the personal milestones, what were the shortcomings in the last 1 year, if you feel these can be addressed and looked into, and then take a decision. Last couple of questions, because we're running very late.
Excuse me, only one clarification required. Certain changes are contemplated for next year NEET. So how it impacts our decision about taking the one more exam?
The next exam may be coming up. So
it can change every year. Sometimes it's your luck, sometimes you have to wait and watch. We have learned during COVID times, no, things can change and all, but nothing wrong if you wait. If rules change, follow accordingly.
So we are getting more and more updates about it. We don't have complete clarity of it. So we will definitely, as the team of Medical Mentor, will let you know, and we will have a seminar on that also about the changing NEET pattern.
Like example, how sir says, diploma from this year or last year onwards is almost gone, and you have more and more MD seats coming up into picture. Yeah, ma'am, what do you ask?
So if you could throw light as to scope of MD, MS, DNB or even MCH for doctors in the administration or abroad, it would be helpful.
I am not able to comprehend your question.
If you can, throw light on the scope of MD, MS or DNB graduates abroad, like work chances abroad or even in the administration field, it would be great.
Can I take this?
Yeah.
If you're really considering to go abroad, both the major countries being Australia, United Kingdom and the United States, walk out of this room right now. Don't think about NEET. Because the main issue that we both personally face going to UK for our fellowships or MCH courses, our MD courses are not recognized there. So don't waste your 3 years of life doing MDs here and then wanting to go and settle in abroad. That's not going to work. I had my own colleague here in BMC, did MD medicine with us, got married to a software engineer who's based out of US. He didn't want to come back to India. He wanted to settle in US. So she had to write USMLE all again, do the residency of medicine 3 all again, and now she's a resident there. So if you've planned, or if your parents are planning a United States boy or a girl or in United Kingdom, please do your USMLEs and PLAB right now. Do not do MD and then struggle again to write another exams, another course there. If your plans abroad, yeah. But after doing your MDs and MSs here, do your fellowships there. Get out of the well. Don't be the frog in the well. Get out of the well, go do your fellowships, and come back and give back to the country who gave you that basic foundation. But if you're planning to settle off, you say India is, if you feel, no, this is not where I want to practice, there are a lot of too many medical legal issues, not medical legal, there are a lot of society issues where you're getting thrashed by every other person. You're reading newspapers of getting thrashed, getting spoken ill of on the media. If this is a toxic environment for you, don't want to do this here, then please start thinking about your plabs, start thinking about your SMLEs, and go out there and start doing your residencies there. Do not waste 3 years of your life here.
Thank
Sir,
you.
sir,
So for
hello.
more
So,
questions, I
Can I
would
just
request
add,
you to
can I just
have-
add another point
Yes.
on that? Sorry. Because her question was, what is the scope after you finish your MDMS if you want to go and do? There are some fellowships available in different countries, and every country has its own rules and regulations. But the general rule is your MDMS is not really recognized as MDMS there. So you will have to struggle, and where you go, you will have to compete with the trainees who are there. So they will get more opportunities. This is more so for surgical branches, I'm telling. Medical branches is all fine. You don't have to have hands-on experience. But for any interventional branch or any surgical branch where you need a lot of hands-on, you will be competing with the trainees over there. So be mindful of that. And these courses are not really very, affordable as well. You'll be paying a lot for them. But you might feel a little cheated afterwards. So just be mindful of that as well.
Okay. So for more questions, I would encourage the crowd to interact with the panelists who are here off stage. For now, we need to close one. Okay, the gentleman is standing and requesting for a question. Last question.
Doctor, see, if there is an accident and they go to Nimans or some neurosurgeon and the person passes away, the family takes it, they were expecting that and they have done their best. But when something mishap happens after a surgery or while delivery of a child, the family doesn't take it, and it sometimes leads to these legal issues. Then, similarly, when this emergency medicine and ICU, people they talk, telling that no, the patient was dead. They are simply keeping them, prolonging the life, and to charge. This type of things are there. Is there any framework where the doctors are protected since they are doing their work well, perfectly well?
I am not sure if it is
Sorry,
the scope.
this doesn't come under
It's not the scope of this
discussion here or the career guidelines.
This is purely imaginative, number one, and it is not under this panel. You cannot discuss this.
Good sure. I think you can take this up with our seniors off stage, and I'm sure they'll be happy to help you with this. There's definitely a framework. There's definitely a way doctors can be protected and things can be transparent in whatever we do. With this, I've come to end of the moderation of the session, and I hand over the session to Niranjan. Please stick around.
Thank you so much. A big round of applause for all the panelists and Dr. Govind Mittal, our moderator, ladies and gentlemen. Well, by mistake, I was about to read the welcome address again because it was so refreshing time and again, even though they're talking, there was so much knowledge. For me, to be very honest, all of these people have taken in so much knowledge. For me, I understood how to pronounce branches' names and how to pronounce diseases' names. So thank you so much for the doctors. All right. Apart from that, we thank the entire team of Medical Mentor, the entire staff of BMCRI and Fuel Media Events to be a part of an unwavering support, who's put in hard work tirelessly day in and day out. And I thank our esteemed panelists once again who've given a flurry of all the knowledge to all the individuals and doctors. I'm pretty sure, I'm fairly confident that all of you have a path laid out in front of you. And lastly, I thank all the doctors, ladies and gentlemen, who've taken out time on a Sunday to come and attend India's largest seminar for NEET PG aspirants. With that, we are open for one-to-one sessions where all doctors can avail their free one-to-one sessions with our expert panel of mentors, and this is something that will also continue to add value from what we've carried out from this session. Thank you so much for all turning up. Thank you so much, doctors. Thank you so much, ladies and gentlemen. It was lovely having you.